is Uwe Brandis. I'm the faculty director of the Global Cities Initiative. This is an event that we've been doing for a couple of years in a row now, and it is in direct alignment with the goals and the mission of the Global Cities Initiative, and that is to foster a dialogue across disciplines about cities. And the initiative has been around for a couple of years now, but recently we've really started to ramp up the activities which directly engage students. We've been working with the faculty as a first point of priority. But this summit is really a wonderful, wonderful way of bringing people together, many like-minded students together who might not ordinarily have the opportunity to meet each other. And in response to the call for presentations that we put out, we got an amazing response from students all across the university, all the different schools. And we've tried the best we can to craft an agenda which is as inclusive of that response as possible. And so I'd like to just welcome everyone and just express my own excitement about this opportunity. Every year over the last 3 years now, the Georgetown Global Cities Initiative has extended an invitation to an outside thought leader and welcome that person to kind of co-create and participate with us in this big, broad, interdisciplinary conversation. And I'm just so excited and really grateful to Angela Glover Blackwell, who's here with us today. She has been serving as this year's visiting fellow. And I'm just so thankful, Angela, that you're here and so excited about the kinds of conversations that we can have today. So a big thank you to you. We've already introduced you to everyone digitally. And I think people are quite familiar with you and your background, so thank you. Before we go on too much further, I also want to extend a very big thank you to Enrique Pelles, who has really been the person who's pulled this all together. Enrique, why don't you wave a big thank you. Enrique is a master's student in the Urban and Regional Planning program and works to staff the initiative. The agenda today has been set up in order to explore different issues that we think are of topical interest. Some of this is very self-evident. And the way in which we wanted to conduct this session is to have students present in different panels, and following the panel presentations, we'll have a panel response. And that response will include Ms. Glover Blackwell, and then also select faculty will be dropping in for each of the panels. And again, I think if there's one goal of today, it is to celebrate the kind of diversity of perspective that we can bring to the issue of cities coming from our various backgrounds at Georgetown. And by doing so, and I think this is part of this goal, by doing so, foster new relationships and connections and awareness of the many different people at Georgetown. And so we will be following up this event with additional opportunities to get together. And we really want to forge new links, new peer-to-peer relationships. And that is an expression, a living expression of the dialogue that we have here. With that, I think we should just kick it off and jump right into the first panel. And so I think we have Vanessa Jarnes from the School of Foreign Service starting us off. Vanessa, I'm going to turn it over to you. Enrique is controlling the slides, so we should be able to move very quickly through all of the presentations.
Great. Thank you so much. I'm so honored to be the very first presenter today. Better to just get right into it. So thank you very much. Yeah, today I'll be talking about migrant worker welfare in Singapore's COVID-19 response. So just a tiny bit of background. I worked on this project last semester under Professor Robin Kang, who's here today, in her class on political economy of cities in Latin America and Asia, where you choose a specific city to follow throughout the semester, and then you choose a specific topic relating to urban planning, political economy, etc., to examine for the final paper. So in doing that, Singapore was really an exemplary city throughout most of the class in terms of urban planning and provision of public services. And so when I was trying to decide on what my research topic would be for the final, I wanted to find an issue that Singapore could actually improve upon. And one of the ones that really stuck out was migrant worker welfare, particularly with the COVID crisis. So next slide. So looking a little bit at the problem, there's vast inequalities between labor migrants and Singaporeans. So the labor migrants live in cramped dormitories. They face significant barriers to accessing healthcare. They obtain significantly fewer public services, receive substantially lower pay than the average Singaporean worker, deal with multiple types of assault, can often be seen as others. There's very much an us versus them mentality between Singaporeans and the migrant workers. And additionally, they live and work pretty much at the full discretion of the private employers. It's a trust the employer system. So the government gives private employers broad leeway in how they handle their workers, which leaves them vulnerable to a lot of things that I can talk about. So my research question was, how do Singapore's policies towards migrant workers drive the level of inequality and neglect that fostered the city-state's COVID-19 outbreak? And in doing so, I went through a lot of different qualitative and quantitative data on employment in Singapore, going through different news, journals, multimedia, et cetera, in order to create the research below. Next slide. So looking at labor migration in Singapore writ large, there's a lot of labor migrants. There's nearly 400,000 Malaysian migrant workers. Others come from places including China, India, Sri Lanka, Bangladesh, among others. The total foreign workforce is more than 1.35 million, which is a huge amount, seeing as the total population is only 5.6 million in Singapore, and the total workforce in Singapore is only around 3.5 million. So, they make up about 40% of the total workforce. And nearly 1 million of them are unskilled or semi-skilled, mostly working in construction, manufacturing, shipyard. A lot of the low-skilled male migrant workers originally come from Bangladesh, India, and China, make up nearly 13% of the population. And a lot of this migration is driven by the wage discrepancies between other Asian countries and Singapore and their desire to remit. Next slide. A little bit about the pay disparity. There is a large pay disparity, as mentioned, between the low and semi-skilled workers and the average Singaporean. As you can see on the right, the basic starting salary for some of the migrant workers is around 400, whereas the average monthly salary is over 3,000. Part of this is because there's no minimum wage in Singapore, so they are very vulnerable to predatory wages from the private employers. And employers often do not even pay the full guaranteed amount or delay their payments. So the Ministry of Manpower, who's in charge of the workers, received 9,000 salary-related claims in 2016, but they're usually very reluctant to do anything about it because they want to maintain a business-friendly reputation. Next slide. Looking a little more at the dormitories. So the male migrant workers live in shared dormitories with very poor living conditions. So all 43 dormitories are located very far away from the rest of the city and other neighborhoods. there's no real legal maximum occupancy, so it leads to them being extremely cramped, up to 20 people for a room, mostly just metal frame bed bunks. And there's up to 15 beds for every toilet, shower, and sink. So you can really see that a lot of these structures are being used by a lot of different people at once. And approximately 20 of the dorm operators have been found to breach the Foreign Employee Dormitories Act every year, which controls these dormitories. Next slide. Looking at the health coverage, so Singaporean citizens receive universal health coverage while the migrant workers are on private health insurance through their employers, once again leaving them vulnerable to, they're at the behest of their employers. Approximately 13% of the migrant workers face barriers to accessing healthcare, some including, high costs, gatekeeping, vulnerability to repatriation. The ones with the lowest salaries, which kind of ties in the wage discrepancy, face the most barriers to healthcare. And a lot of this stems from fear about job loss, fears of getting sent home, missing pay that they already can't afford. A lot of these migrant workers come and go into a lot of debt to come and be workers, so they can't afford to miss any pay. And it leads a lot of migrants to forego their healthcare. Next slide. So looking a little bit at COVID as a catalyst for changing migrant welfare policies, the cramped dormitories led to severe outbreaks of COVID-19 within the worker communities, and they constituted actually 90% of infections by May. And I think as of December, they were 93% of all infections in the country. And it really shed light on the existing inequalities between Singapore and the migrant workers and the dangerous living conditions. You can see on the right, the number of cases in the dorms, sometimes going up to nearly 1,400 versus the number of cases in the community, which was the red line, which you can barely see because it's basically at 0. Next slide. So the government took several approaches to trying to improve immediately the worker conditions, such as creating multi-agency task force, implementing testing, segregation of healthy versus infected, observing the symptoms, creating on-site services, making delivery systems so that the workers don't need to leave. They also made migrant worker welfare a goal for the general election and committed to building new dormitories that had improved living conditions and lower density. You can see on the right the quick build dormitories, and a lot of those are closer to neighborhoods than previously. So they also launched a social campaign to improve public sentiment towards the migrants who are coming closer into Singaporean society. Next slide. Additionally, I want to note, it's not on the slide, but the government has prioritized the foreign workers to be the first for vaccinations this year. Their goal is through the end of this year to get people vaccinated. But additionally, a lot of workers complain about jail-like conditions. So even though a lot of the infection rates are the same now between the migrant workers and the general population was allowed to start doing normal activities in December, but the migrants continue to be in very jail-like conditions where they couldn't leave, couldn't go anywhere more than once a month or once a week. And now this week they're starting to let them do 3 times a week. But very jail-like conditions, and if they were to, break any of those rules, they could have their visas revoked and be sent home to their home countries. So a lot of them felt, very depressed and stuck as if they were in jail-like conditions. So looking at the first proposed solution, which is specific to COVID, they could extend social protection mechanisms to the workers during the pandemic, such as improving social safety nets, providing cash grants for missed work. A lot of the protections that the government put in place was really for the employers. So reducing the foreign worker levy that the employers have to pay for the foreign workers to, ensure that the businesses stay afloat. But I'm not quite sure how much of that, assistance actually translated much to the employers themselves. To the employees themselves. In the long term, they could thoroughly investigate and prosecute worker exploitation, improve oversight for the private employers, institute minimum wage laws, prioritize the construction of higher quality dormitories that are better integrated into society. They could continue to carry out media campaigns to help shift that tone to include migrant workers in society. And a lot of the stakeholders for this include the government, the non-governmental organizations, civil society organizations, and of course the public. The public has to be on board. Even though it's fairly authoritarian, the People's Action Party can't. They faced a lot of backlash in the past for trying to improve migrant worker protections and to allocate more of the budget towards migrant workers. So, getting the public on board for the importance of these migrants is really important to actually have policy changes. Next slide. So in conclusion, COVID-19 has revealed a lot of the longstanding inequalities that exist between the average Singaporean citizen and the migrant workers in Singapore, as well as how the government treats normal Singaporeans versus how they treat their migrant workers. I think that COVID-19 has really showed that not just the Singaporeans themselves, but really the whole city population, including the migrant workers and the Singaporeans, have serious healthcare, humanitarian, economic consequences if the inequalities persist. And COVID-19 has given a good window of opportunity to work with the stakeholders to make long-term changes that could improve migrant worker living standards, particularly because the People's Action Party does not usually allow negative information to really be highlighted. So the fact that this is already out in domestic and international media and is a well-known phenomenon really gives a window of opportunity to acknowledge this issue and try and do something about it. And overall, the government and the public really need to recognize that migrant workers play an integral role in society, the population, and economy. They're really the backbone. They've built Singapore from the ground up, literally in the construction field. And they're such a large part of society that they should start to be treated as such. Thank you.
Vanessa, thank you so much. You get the prize for going first. And in my excitement to get the event started, I didn't invite you to introduce yourself. So could you just say a few words about yourself, maybe where you grew up and what program you're in?
Oh yeah, sure. So my name is Vanessa Jarnes. I'm in the Master's of Science in Foreign Service, initially from Boston, Massachusetts, but I've been living in the DC area, working for the government and going to school here for the last 8+ years. And being in the Master's of Science in Foreign Service, really interested in international affairs, Southeast and East Asia. I thought that the political economy as a city class gave a really great viewpoint into how cities handle some of the global issues and what kind of roles cities play on the global stage. It's not just, state versus state anymore. There's a lot of major roles that cities play in international relations and in the, development of a population. It's becoming much more urbanized nowadays, and a lot of the world's populations are moving towards cities. So they're definitely, the development within cities and how people are treated is definitely like a huge issue, not in international affairs. And so I thought that this was like a really interesting class and something that I hadn't focused on so in depth previously.
That's great. Thank you so much. That's wonderful. Emily, could you introduce yourself and then jump right in?
Yes, thank you so much. My name is Emily Pelles. I am a first-year Master of Public Policy student at the McCourt School of Public Policy. I'm originally from Cleveland, Ohio, and I've been living in DC since this past summer. So I'm excited to share a little bit with you about my research evaluating qualitative differences in COVID-19 response policies in California, specifically at the county, state, and city levels. And this is part of my research as a graduate research assistant at the Center for Global Health Science and Security at Georgetown University. Next slide, please. So to begin, I've examined 2 research questions. The first being, how does the population level and urbanicity classification of a given city or county impact that locality's COVID-19 response policies? And the second question I examined is, to what extent do counties and cities interact with state level policy guidelines? For example, do they defer entirely to the state level policy guidelines, or do they adapt their policy measures to either be more restrictive or to provide additional guidance for their locality? Next slide, please. I focused my research on 8 different counties and 3 cities within California, and you can see those listed on this slide here. My selection criteria was based on the geographic location in the state, the population level, and the urbanicity classification. And to determine urbanicity, I referred to the Office of Management and Budget's Metro Counties classifications to determine whether a given county was considered urban or rural. Next slide, please. So to set the stage a little bit, I want to provide some information on state level policy guidelines in California. As you can see, it was about a year ago that California declared a state of emergency, and its stay-at-home order followed on March 19th, 2020. California has produced dozens of policies over the course of the pandemic, and you can see here some key policies over the past year, and you can see how this case levels have risen during the summer and then again during the turn of the new year. And right now, California is engaged in the Vaccinate All 58 for all 58 counties within California. Next slide, please. Today, I'll be sharing with you 3 select case studies of Orange County, Madera County, and Modoc County. Next slide, please. So to begin with Orange County, this was the most populous county that I examined as a part of this research project. It has a very large population and it's considered an urban county. The majority of the policies within Orange County I found focused on social distancing and restricting movement. Of course, they covered a wide range of policy areas, but that was the most predominant policy classification. And within Orange County is the city of Santa Ana, which is the county seat. And here in Santa Ana, I found that the policy is primarily focused on enabling and relief measures directed at both the general population and the private and public sectors. And it was very interesting to consider different policies between Orange County and the city of Santa Ana. For example, Santa Ana had policy measures focused on restricting rent, or putting a price cap on rent prices, making sure that city utilities weren't shut off, whereas Orange County had policies related to issues such as restricting visitors to county jail facilities and other social distancing measures. So it was very interesting to understand the interaction between the city of Santa Ana within Orange County. Next slide, please. I next looked at Madera County, which has a mid-sized population. It's located within the middle portion of California, and it has an urban classification based on the OMB's Metro Counties criteria, but I would say that there are elements of both urban and rural characteristics within the county. And similar to Orange County, Madera County also had policy responses focused on social distancing, and contact tracing was a primary focus of Madera County. Something interesting to note about Madera County is that they frequently deferred to state level guidelines while also developing their own policy measures. So it was a mixed bag, I guess, of policies, both clarifying state level guidelines and developing their own policy measures. Next slide, please. Finally, I looked at Modoc County, which is in the very northeast corner of the state of California. It is a rural county with a very small population. And the majority of these policies also focused on social distancing measures. As you can see from the graph here, they didn't begin having cases or producing policies until the summer of 2020, likely based on their small population. And I thought this was very interesting to note that the county did respond as cases were coming into the county, and that just didn't happen to be until the summer of 2020. Next slide, please. So my key findings from this research project are really the importance of understanding the different roles that each level of government can play in responding to the pandemic. I think it's very important to consider the different functions of each level of government, particularly from the example I described earlier, regarding Orange County and Santa Ana City, there are certain policy measures that only a city or only a county can put into place. And so that interaction between the various levels of government has been very important for having a strong response to the COVID-19 pandemic. And I've also concluded that the importance of this interaction across all three levels of government, across city, county, and the state level, has been important to California's COVID-19 response. In particular, every locality that I studied did operate within state level guidelines, whether they adapted them to be more, more specific and more focused on the county's specific needs, or whether they simply defer to state level guidelines by reposting guidelines for residents to more easily access state level guidelines. Each county and each city did interact in some way with state level guidelines. And I think moving forward, this is a good, California provides a good case study for understanding interactions between different levels of government, but also just the importance of intergovernmental collaboration and communication and coordination. I think that's something we're seeing, especially with the vaccine rollout, having clear lines of communication between coming from the state to cities and counties, and making sure that localities are following these state policy directives has been really key to a strong COVID-19 policy response, and I'm sure will continue to be critical to responding to the pandemic. Thank you very much.
Wonderful, thank you, Emily. And I just wanted to explain that we've also identified student respondents. So some students will not be presenting, they'll be responding. And I'd like to invite Matthew Boyce to introduce himself and offer some reflections.
Good afternoon, everyone. I am Matt Boyce. I'm from Chicago originally. I'm a first year PhD student in the Global Infectious Disease program at Georgetown, but I worked at the Center for Global Health, Science, and Security for several years before starting that. So very familiar with Georgetown and the landscape and all the fantastic work that the Global Cities Initiative does. So I guess first, thank you to Vanessa and Emily for your incredibly fascinating presentations. I think, so there's no playbook for this, right? Uwe, do you want me to address each presentation individually or just comments as a whole?
You have the floor. Just share with us what's on your mind.
Sure. All right. So I guess we'll start with Vanessa's presentation, which, it's one of those, I think that, it's a little bit of a, trite or cliche statement at this point, but it's, people frequently say that disasters often, illustrate some of the more insidious aspects of our society. And to the extent that pandemics can be considered a disaster, which I think they can, I think that Vanessa, your case study of Singapore did a really, really good job of illustrating just how pervasive the inequalities in the city are. And I really like the idea of framing the pandemic, which, to be clear, it has been a horrendous event. I don't think anybody would choose to live through the past year as we have if they could avoid it. But taking it as a catalyst for urban change and growth and development, I think that's a really important transformative idea, because I do think that there have been some very clear issues that have been brought to light in cities. And to your point, there's a window that's open to address them. And so it's, a matter of, I guess, what authority does the local government have to do that? And then beyond that, if the city's in a federalist nation, are there higher levels of government that need to come together to help address some of these challenges and kind of galvanize that change. But I thought your presentation and your recommendations were very cogent, especially the just, extending the social protection mechanisms. Yeah, I mean, you could talk about healthcare reform, which is, a hot topic in the United States, obviously. But it sounds like it could be there too if the migrant workers are relying on employer-based insurance, whereas the rest of the country gets universal healthcare. That's a clear inequality, and I'm of the opinion that something should be done about it. And shifting gear to Emily's presentation, I think, well, one, hi Emily, good to see you again. It's, I think the question of to what extent do counties and cities defer to those higher levels of governance is a really interesting question. We've never, rarely do we go through these types of events. And so also very rarely do the various levels of governments get opportunities to work out the kinks and figure out what exactly they're going to do. You can talk about exercises and simulations and all of that, but I mean, that's exactly what they are. They're exercises and, simulations. You don't actually know how things are going to go down until they actually go down. And so figuring out what level of government is going to issue what recommendations and how are those going to be enforced or implemented and whose responsibility, who has the authority to do that, I think is a really, really interesting idea. And, you focused on California, and I mean, I think there are some really other fascinating case studies across the United States. The one that's coming to mind is I think the governor of Georgia sued the mayor of Atlanta at one point early on because she wanted to enforce stricter business restrictions, and Governor Kemp is very much opposed to that. So figuring out what that balance is between those different levels of governments, I think, is key for learning from the response to this pandemic and moving forward and improving future preparedness. Thanks.
Thank you. Angela and John, thank you so much for being with us. And Angela, why don't you start with some reflections?
Thank you. And thanks for inviting me. This is so interesting. Vanessa, I'll start with yours, which I was particularly interested in because early in the pandemic, we were focusing so much on Singapore. It looked like they really had it together in some ways that we were struggling with here. And then we heard about the dormitories and what was going on, and that took a whole different turn. So I was really fascinated just that you had selected that topic, and wanting to learn more, I was left with so many questions. One of the questions that I had was, what is the race, ethnicity dynamic going on in terms of who are the migrant workers? You gave some information about that, but I was curious historically, how does this fit in to the development of Singapore? There seemed to definitely be some sort of hierarchy of human value going on there, but I didn't have enough information to understand it historically. The other thing I was thinking about is how separate the migrant workers are, that there could be so much infection going on of the virus and the rest of the population not picking it up at all, which made me wonder to what degree, other than the building, the physical construction of what's going on in Singapore, is there another contribution to the economy? Because there didn't seem to be much interaction with the rest of the economy, which made me wonder, how do you make the case about the interconnectedness? Is there a case to make that if you get it right for the migrant workers, there's a broader societal impact? I assume that it's there, but it just seemed to be so separate. Also, the notion that this is just a benefit to the employers, therefore the benefits, the employers have to carry all the burden of health insurance and housing and all of these kind of things, though I may be wrong about housing. It sounded like government is providing the housing.
They're employer provided, but government can oversee it, but they're employer provided dormitories.
Right. So it's complete. It's as if this is just a benefit to the employers, therefore you pay for it. But it's 40% of the workforce, so it's so not true. So I was looking for more in terms of what's the sort of discriminatory history with all of this? How has it benefited the larger society, and what's being lost? Clearly, something's being lost by not being able to tap. So that was just so interesting. Thank you. You raised a number of questions for me. Emily, you know, I'm from California. I was on the governor's task force, so it's sort of not fair for me to comment on what you were saying because I know way too much. But there is an element that I wondered if you wanted to think about a little more, because I was just on the phone with Mark Galley yesterday, trying to think about how to bring some of, who is the head of health services in California, for people who don't know. And the conversation was about how to bring some of the equity practices that they brought into contact tracing and social distancing and other things into the vaccines. So it was just so interesting because we had worked together on how to make sure that there were incentives coming from the state of California to the counties to get them to pay attention to the census tracts that were most impacted negatively, so that they couldn't really begin to open up unless they could show they were having an impact there. Now something very interesting is going on with the vaccines. I want to try and say this carefully. I was trying to remember it as I was preparing, that what Mark Galley was saying is because the big institutions, the hospitals, the big institutions that are doing the vaccine, that they really have to make sure that people aren't jumping the line, that people make appointments, and the people who've made the appointments are in the tiers that have been invited to make appointments, want to make sure that they're getting it. But in the communities, it's a real struggle not to let people jump the line. For example, if a 27-year-old Latinx man brings his 82-year-old grandma, you want to get him too, but we have these other restrictions. So it's very interesting the way it's cutting in other ways. So I think there's a lot to do in this area that you have picked out looking geographically. And here too, we need to bring in more about race and ethnicity because it's a lot related to that. So but thank you both for your work. So interesting.
John?
Well, let me say that Uva, terrific program, and to both Vanessa and Emily, it's nice to see you again. Terrific presentations. A couple things, and I won't have Matt and Angela have hit some points that I definitely would make. Maybe just a couple thoughts. Vanessa, first off, terrific presentation again. I thought you did a really nice job of describing a complex situation and then taking it down to some specific issues. As Angela mentioned, you know, I think the affirmative, the institutional segregation that clearly is the policy of the Singapore government is quite striking, maybe not in its intent because we see that around the world, but the effectiveness that it, so I guess a couple thoughts came to mind. One is you're identifying an issue that is not limited to Singapore. This issue of the segregation of migrant workers is an issue worldwide. And I think maybe you put your finger on an incredibly effective public sector at many things, including this unfortunate thing. But I'm really fascinated that the segregation was so successful that, you know, kind of where Angela is going, I don't know how they managed to maintain the I guess it depends on where the work, I was wondering where those workers were when they weren't in the dormitories, such that they were able to maintain the separation and manage maintain the separation for the population as a whole. So that's point one. And maybe point two, if I understood one of your maps, as they're rebuilding dormitories, they're rebuilding them in communities, or at least closer, not as far outside of the center and presumably near a community. So I'm wondering if that presents an opportunity for allowing foreign workers to access public services alongside Singapore residents, whether it's public or nutrition or et cetera. So just, it's more of, those are just questions about what's next, but I thought it was a fascinating presentation. And then Emily, a terrific job on your end. I'd say I would never know as much as Angela does about California government, but I would just say my experience is that counties in California exercise an extraordinary amount of governmental power across a broad range of programs, unlike almost anywhere else in the United States. So I thought it was really interesting that you focused on Santa Ana, the difference between the county government and the local jurisdiction, because as you know, local governments for the cities, and they tend to have a much more circumscribed level of authority. And so trying to figure out those areas where the local governments have power within the county to do something different from the county as a whole is really interesting. And as Angela suggested, my guess is there you can see race and other the politics of that playing out differently. I thought it was interesting when you picked Madera, and I don't know the geography of California as well as you do, but my recollection is that Fresno is just outside of that county. And it would be fascinating to see if Fresno also acted more like, the city of Fresno did more like Santa Ana, even though it wasn't did you see it within it? Did it operate? My recollection is Fresno is a county city sort of combination. So did that act differently, even though it's in the same jurisdiction? Because, those are, my sense is they're responding to different political dynamics depending on the locality and who was what constituencies were pushing the local non-county government. So anyway, but kudos for mapping that out, and the charts were very effective. So well done, and to both of you, excellent job. So thank you.
Thank you. I think for some, this entire day is going to be an exercise in frustration, because on each one of these presentations, we could go on for at least an hour. But I do want to just invite Vanessa and Emily just to have a closing word.
Sure, thank you. Just to respond really briefly to a couple of the great questions that the respondents brought up. First, for you, talking about the racial and ethnicity breakdown. It is very interesting. I was doing a little bit of research because one of the other topics I was thinking of aside from COVID-19 was going to be looking at like the cultural breakdown in Singapore, because it's very interesting for a number of reasons, but they have like different little enclaves. They have like a little India, like an Islamic quarter, a Chinatown for like a lot of the main different ethnicities. But in terms of the ethnicities of the migrant workers and how it compares to the general population, what's interesting is that, a lot of the population comes from similar, places and races as the migrant workers. So, there is like a large Chinese population, a large, Indian population within Singapore. And even within, people who came from the same country, whether they're like ethnically Chinese or ethnically Indian, and they're Singaporean citizens, there's still an us versus them mentality between like the actual Singaporean citizens and the migrant workers that are coming from the same exact country. I would need to dig a little more whether that goes into like different case and that kind of stuff. But a lot of them come from the same countries initially, and it's really still a difference of like actual citizenship versus being a transient worker. It's a very interesting topic, and a little bit more about like just how segregated the workers are from the rest of society. Yeah, it was extremely effective, and they, from what I can tell, they have very little overlap with Singaporean society. They're very far out from the city center, from the neighborhoods. They are not allowed to take public transportation to and from the work sites. The employers provide like very cramped vans to transport, which was also a problem in terms of the like COVID crisis. It was not just the dormitories, but also the like transportation was extremely cramped. So in terms of that sense, like they are very separated. They have these recreational centers like specifically for the migrant workers where they can go and shop and socialize with one another and carry out remittances. But like they do not really interact with the broader Singaporean population or with the city center. So it would be very interesting to look a little more into, you know, what it could mean if they were actually integrated into the like actual Singaporean economy, other than just providing a lot of the, you know, manpower and workforce, because they're so segregated from that, it seems. Yeah, they are moving a little closer to the neighborhoods. I think just because, you know, Singapore is a city state, there's not a lot of space. And so they're kind of running out of room where they can build these dormitories. And so they were using a lot of like unused government buildings, like unused warehouses or like libraries or whatever that were no longer being used as like these temporary dormitories, and those were just naturally closer to the neighborhoods, but there was still that stigmatization. So the government and the governments had to carry out this like welcome in my backyard because they're moving closer than they have had to before, and there's still like a, you know, they don't want them in their neighborhoods, they're afraid of them, they're, you know these, you know, racial and kind of like social status stereotypes that they bring disease, that they're dirty, not, you know, of the same quality as the rest of the citizens. So that's something that's like very interesting to look into.
Great, thank you. Emily, quickly, last thoughts?
Yeah, thank you very much. Matt and John, it was really good to see you again. And Angela, it was very nice to meet you here today. I appreciate all the comments that the three of you shared. And I think that the vaccine rollout is certainly something I'd be interested in exploring further. And I think that the points that were raised about both equity and racial dynamics, as well as political dynamics and how that plays into the vaccine rollout, that's certainly something that I will keep in mind as I continue to explore this research further. Thank you so much.
Great. And thank you to everyone on the first panel. We're off and running. You guys paved the way. I really appreciate it. And I just wanted to share with everyone, we're gonna just keep going here. We will take a break eventually, but let's roll right into the second panel and the first presentation. So the second panel widens the scope to broader issues of cities and public health. And I'd like to invite Bethlehem to introduce herself and start your presentation.
Okay. Hi, I'm Bethlehem. Thank you for inviting me to share my study here. I grew up in Ethiopia, then I lived in Tunisia for 6 years and Kenya for a couple months. Then I came to Miami for undergrad to major in neuroscience, and now I'm here to do my global health master's. So yeah, next slide. So I'm going to be talking about urban health determinants in Addis Ababa, Ethiopia. So just to dive right into it, Ethiopia's population is estimated to go from 108 million in 2018 to 191 million by 2050. So 21 to 49% urban population increase. And as you can see in figure 1, Ethiopia is also going through the early demographic transition stages. So a very young population and a unique opportunity for growth. And I wanted to focus my study on the capital, Addis Ababa, because it is the urban center estimated to hold 4.8 million people and expected to double in 10 to 15 years. But there's also a lot of challenges that come with this rapid and unplanned growth. And although there's been initiatives like the Urban Health Extension Program, the main challenges are still related to lack of data and overall weak urban health research. Next slide, please. So in the early 2000s, in anticipation of urbanization challenges, the government established a decentralized approach dividing Addis into 10 subcities, as you can see in the map below. But there has been little effort put towards classifying the basic urban health determinants of these subcities. And that was basically my focus area for this research, just to see what changed over the past 2 decades of this rapid urbanization using survey data, and to point the gaps in development to see what we can improve. So we're going to be looking at access to water, sanitation, basic housing characteristics, and then talk about mobility and urban planning. Next slide, please. So as you can see on figure 4 on the left, Addis has improved in expanding water access. And we see an increase in number of private drinking water sources and a decrease in communal water sources that are piped outside compounds like public standpipes, wells, and boreholes. But there are gaps in availability, with over 42% reporting unavailability of water at the time of survey and about 65% reporting interruption of water for a full day or more over the past 2 weeks. So overall, there is improvement in access and infrastructure, but a severe lack of availability, which is kind of disheartening because Ethiopia is pretty water rich, especially with the Blue Nile and the heavy rainfall season. It's mostly due to lack of proper planning, but that can be improved. So next slide, please. When looking at subsidy levels, as you can see in figures 6 and 7, certain subsidies such as Bole, Lideta, Kirkos have a high percentage of private drinking water sources and more frequent water availability than others. So that indicates, disparities between subsidies. But as you can see, especially in figure 6, there's major differences within the same subsidy alone. So it's hard to pinpoint inequality. Next slide, please. And moving on to sanitation, as you can see, figure 8 on the left, sanitation facilities have also improved over the years with an increase in flush toilets and a decrease in unimproved facilities like pit latrines without slabs and having no facility at all. But only about 10% of these flush toilets are connected to pipe sewage. So there is a lack of proper sewage and wastewater collection system in Addis. And also about 67.76% of sanitation facilities are shared with other households. So a high risk factor in terms of spread of disease through contact contamination. But yeah, again, overall, there's been improvement in the facilities, but there are gaps in quality and sustainability. Next slide. And again, when looking at figure 10 on the left, most subsidies have a mix of flush toilets, ventilated pit latrines, and slab pit latrines. And when looking at figure 11 on the right, we can see that certain subsidies are better off than others, like Bole and Nefas having a higher percentage of private toilet facilities, while others have a majority shared toilet facilities. But the trend is still not clear. Like, it's hard to pinpoint exactly which subsidy is lacking and which is improved. So yeah, a lot of disparity both between and within subsidies. Next slide. Next slide, yeah, thank you. Moving on to basic housing characteristics like quality of roofs, walls, and floors, development is pretty slow, even though we see like high-rise buildings and it's pretty flashy. There was only a slight decrease in low quality housing from approximately 78.78% to 65.01%. So most people in Addis are still living under substandard housing conditions, but there are improvement in certain housing features. As you can see in figure 12 on the left, in the type of cooking fuel used, there has been a decrease in the use of biomass fuels like charcoal and firewood, and an increase in use of electricity. But again, there are inconsistencies in availability, with over 50% of households in Addis reporting frequent power outages for more than 3 times a week. Next slide, please. And as you can see in figure 13 on the left, disparities, again, they're visible with Yeka, Nefas Silk, Lafto, still relying on biomass fuels like charcoal and firewood, indicating lack of access to electricity. And also in figure 14 on the right shows that Aliti and Lideta are characterized solely by low quality roof, walls, and floors, indicating slum areas and also just informal housing, while Bole has a relatively high quality housing standards, indicating wealth disparities between the subsidies. But again, there's still major disparities within, so it's hard to pinpoint. Next slide, please. So moving on to recent urban developments, Addis has been trying to improve the urban mobility standards. So the light rail transit was one of those projects, but it failed to account for pre-existing economic, social, and environmental context, because a lot of people are unsatisfied about how it segregated neighborhoods on opposite sides, because it just cut through the middle of the city, as you can see on the map. And it has very limited access to crosswalks and U-turns. So it increased the traffic problem, road traffic accidents, and also decreased pedestrian safety. So moving forward, big projects like this just need to analyze the current patterns and social context. Next slide. Next slide. Oh, yeah. Thank you. Another big project was the Integrated Housing Development Program, which was in response to the housing shortage and also part of the slum upgrading solution in Addis. However, there is a lack of context analysis again, because these are mostly walk-up buildings and they're usually in the outskirts of town with little transportation options, so they threaten job opportunities. And the World Bank has previously reported that there's almost no coordination between housing, land development, and transportation systems. And also 70% of these units are rented, so they didn't actually solve the 10-year security problem, along with there's just a general lack of consistency in water and sanitation services. Next slide. So overall, my overview and the results just show that Addis is very, it shows the extreme heterogeneity of Addis. Development is very scattered, even in basic everyday needs like type of toilet facility, water source, shelter, and transportation. So it's very difficult to pinpoint intra-urban inequality. Also, there's no expansion area for Addis due to ethnic territorial conflict. It's like right in the middle. So if they're forced to build up with like new flashy high-rise buildings, which really lack pro-poor approaches. So Addis just needs an even more decentralized approach and needs to start looking at neighborhood level data to actually map out the disparities both within and between subsidies. And these are some of the recommendations I compiled, which basically emphasize modernizing from within and cherishing the local. But yeah, I think I'm at my 8 minutes limit. So in general, just the plans are there for Addis. It just needs a bit more support in resilient design, implementation, and monitoring. And resiliency and sustainability are not new concepts to Ethiopia and Ethiopians. I think it's going to be very easy to reintroduce these ideas in the urban context. So thank you so much for listening. And thank you to Dr. Lisa for advising me through this research.
Wonderful. Thank you so much. Anthony?
Great. Hi. I'm going to start my timer because I'm going to try to be as pithy as possible. My name's Anthony, and today I'll be presenting my thesis, which is on modeling syndemics in urban South Africa. Next slide, please. Great. So like many low and middle income countries, South Africa has been experiencing an epidemiological transition from communicable to non-communicable diseases. However, this transition has not been a zero-sum game. It's helpful to think about the epidemiological situation here as with the protracted polarized model. Protracted refers to the prolonged existence of communicable diseases like HIV and TB in conjunction with rising NCDs like type 2 diabetes and depression, cardiovascular disease. The WHO further characterizes this health landscape as a quadruple burden, highlighting not only communicable diseases, injury and trauma. This transitioning burden is linked with rapid urbanization and concomitant rising NCD risk factors, which are associated with lifestyle changes in the urban environment. South Africa is one of the most urbanized countries in Southern Africa, with almost 67% of the population residing in cities. Polarized class, with the heaviest burden falling on poor communities. And this is reflective of a global issue. Africa, home to many of the world's bottom billion, actually has the highest prevalence of hypertension of any WHO region. So in some sense, diseases of affluence and diseases of modernization are actually misnomers. And then another important point is that chronic disease in South Africa is very frequently defined in relation to HIV by people who have it and in the scholarship. This is because of how prevalent it is. 7.7 million people in South Africa have HIV. This is a fifth of the global population, and the virus affects 1 in 8 South Africans. Next slide, please. So the formative approach for examining the health consequences of clustering social and biological conditions has been pioneered by syndemic theory. Syndemics is a theory for understanding disease co-occurrence in context. So there's 3 essential components. So it's the clustering of the 2 or more diseases, the interaction of those diseases, and the large-scale social forces that precipitate this interaction. And so syndemic scholarship is historically focused on poor immigrant communities in high-income countries, beginning in Hartford, Connecticut, with the Sava syndemic among the Puerto Rican community there. But in recent years, the field has expanded to low and middle-income countries. Crucially, one point is syndemics cannot be driven by big data or national ecological studies. Social interaction in that second component is informed by large-scale social forces, but it plays out on the community level. It's empirical, very empirical tool. So, and we'll see this more clearly in a few slides. Next slide, please. So setting the scene here, this study's in Soweto. So the township more broadly is a specifically South African social and urban formation created by apartheid, and townships tend to be proximate to the city but lie at the margins, and they're a mix of urban and underdeveloped areas, and often characterized by extreme wealth inequity. Soweto is an amalgamation of 6 historically segregated townships that politically organized together, and it's proximate to Johannesburg. Migrants flocked here in the early 1900s from around South Africa to work in the gold mining industry, and it's led to ethnic and lingual diversity. And additionally, Soweto is defined by frequent within township migration rather than circular migration back to rural communities. So people tend to stay in the area, making longitudinal studies more feasible. Next slide, please.
Anthony,
so please excuse the, oh,
Anthony,
yes.
Can you cut your video? Because
oh, am I going in and out?
Yeah.
Oh yeah, no problem.
If you cut your video, we'll be okay, I think.
Okay, cool. Sorry about that. So please excuse the copious text on this slide. At the very least, it serves to demonstrate the complexity. And there's a couple points I want to really touch on. So one is this very well-established bi-directional relationship between diabetes and depression. And these links have been shown to be made worse by poverty. And additionally, just repeating this concept of how NCDs are defined in terms of HIV. And for example, a large source of stress for women with diabetes in Soweto is the commonness of death and burial due to HIV/AIDS and the resulting boom of orphan children and caretaking in that sense. Additionally, qualitative studies have shown that NCDs like diabetes and cancer are less understood and harder to seek care for, leading to poor management of HIV comorbid conditions. Next slide, please. So in theory, the idea of syndemic interaction, it sounds intuitive and fit to context for urban environments with complex epidemiological landscapes, but it poses a multitude of pragmatic challenges. An issue typified in syndemic literature is how to measure the diseases of interest. Multimorbidity is a count, it's additive, 1 condition, 2 condition, 3 condition. And syndemic implies concurrent conditions are compounded in a 1 + 1 is greater than 2 fashion, if you will. So it's like one way to test for synergy, to move from a theoretical to empirical linkage, is with an interaction term where instead of evaluating the main effect of 2 or more disease states alone, you test if the outcome changes when both are present. So another concern is for the ability of syndemic modeling to capture disease states in a particular place at a particular time in a particular group, which is important to the definition. And it hinges on the local validity of metrics, which is particularly important for subjective states like mental distress. So with the understanding that stress is socially mediated, in this study, we utilize a psychometric scale developed from ethnographic evidence within Soweto. And lastly, there's a question of outcome. So how do we say that people overall are doing worse? And so we pilot quality of life as a viable holistic measure for gauging overall well-being. And in a developing urban landscape where the experience of health is uniquely manifold, an overall measure of well-being will probably do a better job of gauging diverse outcomes. So you can go to the next slide and maybe next slide. Oh, and then you can go to the slide, skip over this for the sake of time. All right, great. So just looking at some methods, the study was funded by the NIH and implemented in context. A few of the key measures I'll go over. We use the WHO abbreviated quality of life. Our multimorbidity condition count was hypertension, diabetes, chronic pain, high cholesterol, and cancer. And then the SSS, that's a Soweto stress scale that we developed using life history narratives. And I think key to this conversation also is that we used a cluster variable because we wanted to add a spatially explicit geospatial component because Soweto is very heterogeneous and we didn't want to treat it as a monolith. So you get more of like a granular catchment area of how quality of life might be affected by other geographic factors. Next slide, please. Great, so and these are just a few of the selected results. In a sample of 783 Soweto residents, we found that multimorbidity had a negative effect on quality of life, and that HIV had no significant effect. And additionally, we found that there was this significant negative interaction. So if you take a look at the plot demonstrates this change in slope, which is key to interaction, and it provides very important evidence against a dose-response relationship between multimorbidity and stress. So if this relationship were cumulative, we would see parallel lines. And so high stress here, it more than doubles the negative effect of increasing conditions on quality of life. And so basically what this means is, in other words, having both conditions at some degree has a worse effect on quality of life than the sum of their individual effects. And this is also called a sub-additive interaction and antagonism. So yeah, next slide. I know I'm like reaching my end, but I'll try to get this in like a minute. But so a few key takeaways is we know township populations are vulnerable to compounding social and biological harms. And this epidemiological evidence that HIV does not seem to have a significant effect on quality of life. It's supporting these. It supports ethnographic findings, and it also is challenging our health priorities of where we're allocating resources. And also there's the evidence of this negative interaction. It's not causally saying, okay, there's a syndemic, but it's supportive of syndemic phenomena. And what that means for policy is it's suggestive that there needs to be a more integrated chronic multimorbidity management and mental health services. I mean, primary care setting, it sounds very daunting, but even at the tertiary level, integrating these services more and improving surveillance systems will have a greater impact than either intervention in silo. And at minimum, I think this study questions if we are using the best epidemiological frameworks for assessing health in today's developing cities, and provides a nascent pathway forward. So yeah, thank you for your time. I'd like to thank Emily Mendenhall and the SFS. I've been working with her on this since May. So yeah.
Wonderful, thank you, Anthony. Really wonderful. Andra?
Hi. Hi, everyone. I'm Andra. I am at the School of Continuing Studies. I'm getting my master's degree in urban and regional planning. And today I'm going to discuss some of my research that I've done so far on a specific agricultural technology called vertical farming and pretty much its role in urban landscapes. I've decided to focus my project on vertical farming in New York City in particular. As you can see in the image, that is the Brooklyn Bridge. So I will be focusing this presentation, and the subsequent research is on the Brooklyn Borough in particular. Just a couple of really quick facts I want to share. According to the UN, in recent studies, they believe that the global population will jump to about 9 billion people in 2050. And so this implies that there's going to be 2 billion more people that must be accommodated with an increasing production of about 70% for food production. New York City in particular, according to the C40 Cities report, they will be facing food insecurity related tension by 2050. So that's kind of the reason of why I wanted to look at vertical farming as a potential solution to food insecurity in New York City. This first slide, I just want to discuss really quickly what it means to be food secure or food insecure. According to the Food Bank for New York City, food security is an indicator of whether within a household, all household members have access to adequate healthy food at all times. And likewise, food insecurity means that there's a lack of access at times to enough food for an active, healthy life for all household members. And it's limited in uncertainty of nutritionally adequate foods. Next slide. So just really quickly looking at some of the data, some of the numbers of what's going on in the Brooklyn Borough in particular. This is from the Food Bank for New York City. So the highest meal gap in New York City, measured as a number of missing meals, is about 90.9 million missing meals for the Brooklyn Borough as of 2014. And this has increased from 2009 by about 16.5%. Brooklyn has the highest food insecurity rate in all of New York City. So there are about 20% of all Brooklyn residents are facing some form of food insecurity as of 2014. Again, this is up about 9% from 2009. And of the borough's 18 community districts, 8 districts have a meal gap of more than about 5.8 million meals. Next slide. This is just a quick introductory paragraph from the New York City director of the Office of Food Policy. This came from a 2020 food policy report. New York City is clearly, they are aware of the issue of food insecurity happening in New York City. The municipal government is focusing on providing resources to people who don't have access to nutritious food on a daily basis, but their initiatives are primarily focusing on raising incomes and alleviating poverty. So they're looking at it from kind of an economic standpoint, but when looking closer at the report, there's no dedicated section or anything that might include or introduce the use of urban agriculture as a potential solution to food insecure areas. Next slide. So I wanted to get into what vertical farming is and how it could be a potential solution for the Brooklyn borough. In particular, vertical farming is an urban agricultural technique where crops are grown inside buildings within city limits, and they are grown through a controlled environment. So there's precise LED lighting, exact nutrient dispersal, and a maintained temperature year round. There are 3 different kinds of vertical farming techniques that are the most popular. There's hydroponics and aeroponics. I won't really get into them for the sake of time, but my project actually focuses on a hypothetical vertical farm that utilizes aquaponics. So the type of vertical farming technique at the bottom. And it's similar to hydroponics, but aquaponics combines plant beds and fish tanks into one giant ecosystem. So fish will produce nutrient-rich waste, which is then used as feed for the plants. And then the plants purify and filter the wastewater, which is then recycled back into the fish tank. So it's a very, it's a closed loop system. So water usage is cut very much than traditional farming. Next slide, please. This is just a really quick map. I kind of want to exemplify the point that New York City is growing. It has grown very quickly in all 5 of the boroughs, but if you can see in the map on the right, the dark blue polygons demonstrate the highest growth of more than 5,000 residents. And Brooklyn is kind of in the center, and you can see on the eastern portion of Brooklyn, they've experienced the most urbanization. And I do want to also mention that Eastern Brooklyn is also home to many minority communities as well. And so they have an extra vulnerability when faced with food insecurity in the borough. Right, so they are expected to grow at about 10% more than what they have right now. And New York is going to reach 9 million people by 2050 is what the projections show. Next slide. I do want to touch upon really quickly some of the vertical farming benefits if some people are kind of unaware with the technology or why the products that come from vertical farms are so good and beneficial. So the first thing is that vertical farms, they have a controlled environment. So this is done annually year round. The products, the crops that are grown inside, they're protected from any changes in drastic weather. So things like drought, storms, hurricanes, whatnot that might affect traditional farming on the outside. So anything that's also climate related, it's controlled, it's very precise. And so there's always a steady stream of water, light, and nutritional input. And I do want to mention that produce done in vertical farms, they're always pesticide free or herbicide free. So they're not using any chemicals to encourage growth. It's also, there's a closed loop water usage, and it's very low energy because of the efficient lighting system. So with these elements being in constant, they're constantly occurring in the vertical farm, this promotes quick growth cycles. So things can actually be harvested at a much quicker rate than in a traditional open field. Again, nutritional output increases due to constant exposure to nutrients, water, and light. There's a central urban distribution. So because food is grown locally, there's a cut in transportation costs. There's a much shorter time of what happens between production and getting the food actually on your table. It's cut very shortly because it's grown locally. Right, and this also decreases pollution as well because there's lowered greenhouse gas emissions from, again, lower intensity use of energy. And then finally, the annual yields that are typically found in vertical farms, they are about 200 to 400 times more productive than traditional US farming. So a lot of great benefits that kind of go into the vertical farming science. Now, this is the last slide that I do want to take a couple of minutes on because this kind of involves my more quantitative research when kind of looking into the feasibility of putting some vertical farms in the Brooklyn borough. So we know that I kind of described some of the benefits of vertical farms and how they can address food insecurity, specifically in New York. But some of the big challenges that kind of are put in the way of having more easier implementation is the fact that there are extremely high startup costs. And then there are also operating costs that need to be considered, that each building every year will have a certain cost in order to be maintained. And I do kind of want to compare that to potential revenue that can be made by a medium-sized vertical farm in Brooklyn. So the study, what I looked at was essentially looking at a vacant 30,000 square foot warehouse in the Brooklyn borough by using an aquaponics system. And the reason I chose aquaponics is the fact that there is vegetable produce and also protein that you can develop in the vertical farm. So there's a bit more nutritional output, there's more caloric intake, it's part of a more complete meal, which is why I want to see these products in particular to kind of calculate and see how feasible they are. And so I am looking at using lettuce and tilapia as the primary outputs. And I just want to show you really quickly, if you can see the numbers on the screen. Startup costs, essentially equipment, permits, buying the warehouse or renting it, that actually totals to about $5.1 million with considering the real estate in Brooklyn. Fixed costs such as rent and heat total to about $580,000 annually. So this is something that is paid every year. And then there are marginal costs to consider, such as water, employment and labor, buying seeds, etc. And this again totals to about $1.5 million annually. Now, when we look at the comparisons of these are the costs that it takes to have a functioning vertical farm in Brooklyn, but you can also look at what the annual revenue is from the lettuce and tilapia that you could produce per year. And so the aquaponics lettuce annual revenue actually totaled to about $1.9 million a year. And that's, again, because lettuce has a very short harvest cycle. So you can actually harvest lettuce every 12 to 14 days. So you have a huge amount of yield as a result. And then the aquaponics tilapia annual revenue totaled to about $540,000 per year. And that's because tilapia takes longer to to grow and mature. So you have a slower growth in that sense. But when comparing the total yearly gain or the total yearly loss, because I didn't know how it was going to end up working, when comparing the fixed and marginal costs versus the aquaponics revenue, the total yearly gain actually ended up being about $340,000 annually in profit, which is something that was actually quite surprising considering how many people think vertical farms are not really, they're not really good with their business model. One final thing that I do want to share is I ended up doing a statistical analysis called the Monte Carlo, and I ended up doing 10,000 statistical variations that ranged 10% above and below the average costs of lettuce and tilapia in New York. And this is just to kind of demonstrate the economic variability. The market, it's kind of trying to imitate the market. Some prices will be low and sometimes, and then some prices will be higher. And after doing these 10,000 variations, the average profit actually ended up being around $340,000 annually, with the farm being 90% profitable most of the time. So again, these are very interesting conclusions that definitely demonstrate that a vertical farm is not necessarily a lost cause. It can be feasible. The biggest challenge is finding enough capital to actually start your vertical farm. This is why usually major urban agricultural businesses are they're usually the ones in charge and opening up new farms in different areas of different cities. And it's been more challenging for small businesses, small vertical farm businesses to kind of get started. But there are definitely incentives out there, green incentives. It depends on city by city that kind of give either tax benefits or other financial incentives to kind of cut those costs. And that once the initial cost is kind of reached or surpassed, the economic feasibility model of the vertical farm actually shows that you can profit from it year by year, if not by at least a slight margin. So next slide. So that's the end of my presentation, some of the research I did. I wanted to give a special thanks to Chris Pike. He helped me guide my initial research last summer. So thank you, everybody.
Thank you. We have Ana Paula. Can you introduce yourself?
Yes. Hello, everyone. Good afternoon. I'm Ana Paula. I am, since Bethlehem also started with this, I'm Brazilian, speaking to y'all from Brazil, from Rio de Janeiro. And it's a pleasure to be here in this virtual world to comment a little bit on our second panel. I am a PhD student over at the government department here at Georgetown, and my work mostly centers on understanding urban policies to address mostly also urban challenges in the developing world. I've worked a lot with public security and safety, drug policy, criminal justice systems, and during the pandemic, I did a lot of work with supporting the response to COVID-19 here in my country that is still having a hard time coming out of this crisis. I wanted to offer a few comments for each one of our great presenters. And I'll start with Bethlehem then. To your point, Bethlehem, if I understood correctly about how we need to go local and push the city's administration to understand each one of the local challenges, I wanted to push back a little bit in terms of two movements. One is how the city engages the population in co-constructing these policies to address certain challenges. And I'd push you to look at the Brazilian example. I'm biased, but we have a history of involving communities in building our public health system. And that's a very interesting kind of, I don't know how it would translate specifically to the Ethiopian context, but it's a very complex type of governance since we have a single system for the whole country that brings together the federal, state, and municipal levels. But on the other side, one thing that I found myself wondering after looking at your presentation and hearing you speak is how much of this variation and lack of integration, let's say I'll bring the example of the sanitation issues that you brought up, like the flush toilets, they aren't connected to the plumbing, I forget the name in English for whatever it is that I'm supposed to say now, but there is it more an issue of not having the back integration. And there are certain challenges that are localized and that you really need to drive down to the local community, but in a certain way, what is the mechanism so you make sure that they're not at a loss when it comes to integrating to a wider system in the city? And what are the politics of this? That's something that I wanted to push you to take a look at. And if this cutting out of the city in different boroughs, in what measure does it strengthen the type of policy response that you can have? And what are the weaknesses that it creates in the system, thinking how things should be integrated down the line? To Anthony, I did a lot of modeling myself over this whole COVID-19 issue. but I did not, was not as familiar with syndemic modeling, and I really appreciated your work. I had a couple of questions, and I really understand. I worked a lot with a colleague over at the government department on the situation in Malawi and understanding HIV/AIDS in the continent. I'm fairly familiar as well with the issues around HIV/AIDS here in Brazil. But I was wondering what other types of diseases are top of mind that you could plug in your model, and at the end of the day, you would find no significance. So I'm worried about sort of, this being the type of modeling that if you do put any specific disease in there, you'll have that type of result. And I'd push you, I don't know if you've done these checks, I'd push you to make them. Because at the end of the day, what is the conclusion? No specific disease will bring you a burden when you control for the overall burden of disease, when we're talking about its impact on quality of life. So it's a compound that we should look at, and we should resolve at the basic, and I'm sorry if I'm using the wrong words in English here, but we should look always at the compound and try to solve those at the basic level and using prevention, etc. Or is it actually like, are we talking about HIV/AIDS as this focus of a lot of policy attention? And on that point, I really want to push you as well. What do these communities get by focusing on HIV/AIDS? And what are we losing if we push attention away from HIV/AIDS? So here I'm talking about the political economy of public policy at this very local level. There's a lot of aid money for HIV/AIDS. So how do we engage both the communities in looking at these other types of diseases, but also donors and international donors? And here I'm speaking directly, again, I don't know what the situation is in Soweto, but in Malawi, for example, this was a big issue. The donors were available for HIV/AIDS, and that's how they financed a lot of the back office of their public health system. And they would lose this if they stopped focusing on HIV/AIDS. So that's one point that when we're talking about, our models and bringing in our input to the policy world, we also need to sort of think through and think, okay, what is it that the actors on the ground are gaining? What are they set to lose if we change this focus? And how can we mitigate this? And what's the advocacy work that also needs to be done on that point? And finally, to Andra, really great presentation. I was not familiar with vertical farming, but I had a couple of questions also on the policy side. They chose a political scientist to come and comment on these 3 papers. So I'm going to take this as an open door to come with these comments. But I wanted to ask, okay, like this is certainly a solution. What are the current problems that make people not be able to implement it and access it? And what are the solutions that could exist to make this viable? And I have 2 points here. I'd love to see a next step in your research, looking at the specific incentive policies of the city of New York. Is there a specific program for the borough? Are there policies, incentive policies you could piggyback on? And then what's the other flip side? What are the mechanisms that the city needs to put in place in case it makes this investment to make sure that the produce that comes out of these vertical farms is accessible and useful for the community? I don't know, I'm not familiar with the places and the habits of people in Brooklyn, but I'd also ask, like, is tilapia and lettuce what they actually eat? And here I'm very reminded of a lot of international aid programs that come in with this solution and say, we're gonna, bring in, there was one program in Brazil here that wanted to install ice skating factories. Well, newsflash, Brazil does not have winters. We do not use ice skates. So if you want to install an ice skating factory here, it's not a good idea, even if it is economically viable. So I'd pay attention to those, the cultural and consumption patterns of the community, and especially the underserved communities. Are these food types that they eat? And how do we make sure that you create market incentives so that these are not vertical farms where the produce is then sent out of the boroughs? Or if that is the model, then how do you get that revenue then flushed into the community through some other way to guarantee food security? But those are my comments, and great papers. I really enjoyed the presentation. Thank you for having me.
Thank you, Anna Paula. That's great. I'm going to open it up now, Angela.
Thank you. Again, so interesting, and areas that if I think about them at all, I'm often thinking about them in a different context. And so it's so interesting to see how these things relate. Going to the first one, Bethlehem, what I was really fascinated by was the progress, that in each instance you pointed to progress. And I was so curious about the stories of the progress. How did it happen? Who was able to benefit the most? What was the resistance to it? I absolutely got the impression that things are on the move, but the same people who are always left behind will be left behind if we don't pay attention to the story and what's going on. So that was the main thing that I took away, just wanting to know a lot more about what's driving it. What are we learning about how to make sure that pickup and advocacy or whatever it takes for it to go deeper into society. So that was what I was worried about, but I loved what you were pointing to. Anthony, when I listened to what you were talking about, I didn't know the term, but we have been talking about the integration of so many things that lead to poor quality of life, bad health outcomes, and how the systems are organized so much within silos that nobody's really paying attention to how these things integrate. Very often in the United States, what we're talking about is the impact of race and place, and how everything that you worry about, you can take back to that impact of race and place. And so I was left really thinking about the issue that Anna brought up. I think was the same one that I was thinking about, because a long time ago, I used to work for the Rockefeller Foundation, and we did a lot of work around HIV. And we go to all these different countries in Africa, and all we look at is what was happening around HIV and AIDS. But there was so much more that needed to be addressed. That was just sort of obvious when you walk in. And so I was really curious about how to be able to have impact, to be able to see progress if you move away from sort of the single focus into the integration. What's underneath that? And what's often underneath it is poverty, is what's happening in places. So just wanting to know more about what's the positive impact of being able to have a more realistic approach to what causes people to have a poor quality of life related to the interactions of multiple diseases. And Andra, I had just such a fascinating topic. I'm sure that you know about the project in Cleveland, Ohio, the worker-owned vertical farming that's been going on there. What I was fascinated by when I visited Cleveland, Ohio years ago to see what they were doing with the growing of lettuce is that they had a market for it. And it was the hotels and the hospitals. And so I really am curious about who really is the market. Anna was suggesting that the people may not be, and they might not be. And I do tend to believe that part of the problem with food insecurity is poverty, because we have so much food, we waste so much food in this country, but yet we have so many people who are food insecure. That thinking about ways to be able to improve incomes in communities and improve incomes because they are able to produce something. I love the worker-owned concept, but I also love being able to build up the market. And what I didn't see in your economic analysis is whether or not it would be profitable, or really if it would work for hospitals, hotels, schools to be the market for this, and how much income that could produce. So all very interesting papers. Really enjoyed it. Got me thinking about a lot of things.
Thank you. Bernard?
Yeah, thank you very much. Very interesting presentations, really very interesting, and a lot of quite useful comments which have already been made. So let me run quickly through the three quite different presentations. Bethlehem, what you clearly showed is that what you call the violence of urbanization things go up, things appear, it looks fantastic, and improvements do occur. But without a really systematic pro-poor approach, it's patchwork. That's an issue. And you have to deal with, the cities have to deal with later on, because there are inequalities and they cluster in particular districts. So what do you do about this one? So my question is, do we have data? Do city administrations really look systematically at pro-poor approaches? And Anna brought up the issue from Brazil, because there we know involvement of the community. It has been in many urban slum developments and in the South, a major issue. So question, is that happening in Addis as well? Are there opportunities? Do you see them there? You brought up as well the perennial issue of no coordination between housing, land development, transport, health, you know. Any ideas how that could be improved? That is, you know, it's happened city after city after city after city. What would we do about it? What data would we need? So that's the first one. Then Anthony, syndemic, yeah, it's now an interesting concept. And I really, really like that the conclusion of your study showed what a lot of people have been saying for years and years is we make such an effort to control AIDS and we forget about everything else. I mean, HIV/AIDS is not the central issue for many of the people if you do CAP surveys. It's not. And mental health issues are often the central issue which people deal with. So I think a more broad-based approach where you cluster diseases and then look how they impact a given population is a very useful approach. And I would have to say to balance off the donor community's fascination with HIV/AIDS. It is incomprehensible that about 40% of all development assistance these days go to HIV/AIDS. And if you would ask me, because we did the work on it, how much does go to mental health? 0.1%. The percentages just don't make sense. So I think I can congratulate you that you bring out some of these issues and put methods at work which could give us a more balanced approach. Hopefully the donors will listen. Finally, to vertical farming, I know very little about it, but I was wondering when you presented it, I was immediately thinking of port cities and old warehouses, and I was looking of Alexandria, you know, where old warehouses are torn down these days and high-rise or medium high-rise luxury apartments are created. Would there be possibilities to use some of this one, because the facilities are very often city-owned? So one question. And the second question is, for low-income populations, the access to vegetables, even in rural areas often, or in peri-urban areas, is very complicated. So the short that you can grow them in the cities, that you don't have to transport them, might be something which could be really helpful. So these are my 3 unkempt thoughts.
That's great. Thank you so much. I think that we need to keep moving. I'm very sorry. You know, each of these presentations, you know, we have such a long conversation about, and I do want to make sure that we stay on schedule and everybody gets to speak. I just want to check in. Angela, do you want to take a quick break now, or are you comfortable breaking away?
I'll be comfortable breaking away only for about 5 minutes, so don't worry.
That sounds great. That sounds great. So let's keep moving. I'd like to thank everyone on panel 2. That was absolutely wonderful. We are moving forward and we're broadening our scope even more now and looking at other forces of change in global urbanization. And I'd like to invite Jack to kick us off. And Jack, just say a few words about yourself and which program you're in.
My pleasure. My name is Jack. I am majoring in science, technology, and international affairs. I'm an undergraduate, a senior in the School of Foreign Service. From Chicago originally, now loving DC. Yeah, so to start, for my thesis, I was looking at equity within the Making Cities Sustainable and Resilient UN action, specifically in its implementation in urban Africa, specifically secondary cities. Next slide. And to start, I would just like to acknowledge that I am presenting on the traditional territory of the Shoshone-Bannock, Salish Kootenai, and Cheyenne tribes. I pay my respects to these tribes and commit to a principle of respect and care as part of this presentation. Next slide. So the 3 cities I chose for my analysis include Dawa, Ethiopia, Kisumu, Kenya, and Kampala, Uganda. Kisumu and Dawa are illustrative of many emerging sub-Saharan African cities with populations hovering just below 500,000, high urbanization rates, and governance and service provision challenges. Kampala, Uganda's capital, on the other hand, stands in contrast. It's a city of 3.5 million residents with comparatively robust institutions. Next slide. According to United Nations data, Africa is the fastest growing and fastest urbanizing region in the world. Specifically, this growth, a lot of it is expected to take place in secondary cities, small and medium cities with less than 1 million inhabitants. Rapid unplanned urbanization within these cities has led to growing informal settlements, growing poverty, and growing inequality. And combined with a weak government capacity to adapt to these challenges, it's a grim cocktail. The poor in these cities are especially vulnerable to increasingly severe natural disasters, namely in the form of urban flooding, which poses a justice issue in Kisumu, Kampala, and Dawa. These cities must all contend with this issue. Next slide. Seeking to foster local sustainable urban development, SDG 11 states the goal of creating inclusive, safe, resilient, and sustainable cities. You can hit the animation. Born from this program, as well as the 2015 adaptation of the UN's International Disaster Risk Reduction Framework, the Making Cities Sustainable and Resilient initiative was born. A 2016 to 2019 United Nations Office for Disaster Risk Reduction program focused on building the capacity of local governments to manage disaster risk, focusing on crisis-prone cities in the global south, 5 of which were in sub-Saharan Africa. Kampala, Kisumu, and Dawa stand among them. It's important to note that this program acted as a guide, sort of as a dispensary of the UN's advice on resiliency rather than providing any sort of meaningful funding for resiliency programs within cities. But it's important to question what form of resilience was sought here. Resiliency is broad, abstract, and often ill-defined in urban planning frameworks, leading scholars to question, you can hit the animation, whose resilience is prioritized against what shocks or stresses, when, where, and why. It's especially important to ask these questions of influential UN programs, specifically in their rollout to secondary cities, which are spaces of both immense challenge and immense opportunity for sustainable development. Next slide. Thus, I asked the question, has MCSR considered socioeconomic equity in its engagement with emerging sub-Saharan African cities? Next slide. My argument is as follows. Were the program's framework, implementation, and outputs to consider equity, they would have addressed the 3 pillars of justice: recognitional, procedural, and distributional equity. I examined this argument via analysis of interviews conducted over Zoom with UN officials involved in MCSR, as well as disaster management actors in Kisumu, those working in Red Cross, as well as some local government departments. Next slide. I find that actions featuring a focus on inequality and justice are piecemeal across participating cities, suggesting that the decision to prioritize or ignore equity may not be a direct result of MCSR's framework. Again, this program centered around building the capacity of existing institutions, as well as providing technical solutions to resiliency issues. Moreover, I find that MCSR left it up to the city governments themselves to do the recognition, to do the inclusion of vulnerable communities. Also, again, the program did not provide the resources with which to implement its resilience guidance, allowing only cities with pre-existing institutional capacity, like that of Kampala, were able to take advantage of the program's offerings. Finally, the disaster risk reduction action plans developed to foster long-term resilience, or the UN's conception of resilience, was built on a conception of resilience that lacked an equity focus. Next slide. In terms of the barriers I found the UN faced in implementing this program, they rested largely and consisted largely of political and financial constraints, especially within secondary cities, which often don't possess the institutional capacity needed to implement MCSR and didn't have the funds for the implementation of the resilience programs advised for by MCSR. Both constraints can be found in Kisumu, a city which grappled with high institutional turnover and significant financial limitations, as shown through these quotes. Next slide. I find that MCSR failed to build equitable resilience in these secondary sub-Saharan African cities. Rather, it exacerbated injustice, both within cities through the support of the institutions which helped contribute to the structural injustices in these cities in the first place, as well as between cities. Again, the program was really only to help cities with pre-existing resources, furthering the gap between primary larger cities like Kampala and secondary cities like Doha and Kisumu in sub-Saharan Africa. Rather, I believe that transmunicipal urban networks need to focus on providing specific real support to secondary emerging cities and actively work on bringing vulnerable populations to the table at every stage of the process, while targeting the root sources of vulnerability, such as through literacy and education programs. Next slide. Thus, the question I find becomes, how do you best support these local governments to build an inclusive form of local resiliency themselves, rather than having to rely on outside funding entities and networks like MCSR to achieve a conception of resilience which is developed with a different frame of thinking. I believe that future research should focus on analyzing the longer term equity results of programs like MCSR. And I'd like to note that my interviews were conducted with the elites of this program, the coordinators, as well as the institutional actors involved. Thus, my research may fail to reflect the perspectives of the disenfranchised of these cities. Thank you.
Thanks, Jack.
My
Thanks
pleasure.
very much. In the spirit of moving along here, Khushbu, thank you so much for being here, and the floor is yours. I think you're on mute, or you have microphone problems. Enrique, let's move on and then we'll circle back. How's that? So Elena, are you here? Oh yeah, there you are. The floor is yours.
Thank you so much. Hi everyone, I'm Elena. I'm a first-year Master of Public Policy student at the McCourt School. I'm Italian, but I lived in the UK for 8 years. And today I would like to talk about the establishment of metro cities in my home country, in Italy, and also about the implication of a series of reforms that led to their creation. So what are metro cities? They are subnational entities that are intermediary between regions and municipalities, and they include a large core city and the surrounding towns. There are 14 of them in Italy, including Milan, Rome, and Turin, which is the city that you see here, which is where I'm from. So I think this topic is relevant to the panel on urbanization because one of the forces of change in global urbanization is the push to devolve some or more power to the subnational level, whether it's regions, states, or local governments. And the Italian case, I think, can be instructive because Italy tried to empower these urban agglomerations constitutionally, but as I will argue, did this not result in their empowerment necessarily. So first, I would like to give you just a bit of ground this debate in the city powerlessness literature in both political science and legal scholarship. So on the next slide, you'll see that many scholars, including Herschel and Barber, argue for greater city empowerment. And Herschel, in a recent book, argues that it's paradoxical that despite extensive urbanization and the transnational nature of the issues that cities are expected to address today, it's paradoxical that the majority of urban agglomerations around the world do not exist constitutionally. And US scholars Schrager and Briffault argue that the constitutional non-status of cities limits their power in several ways. First, cities can be victims of state preemption. So states can pass, in the US, states can pass ideological laws that override local ordinances. Secondly, cities have limited influence at the national policy level stage. And then finally, there is a gap between the scale of the issues that cities are expected to address and their ability to do so, as their funding offer depends on higher levels of government. So the bottom line is that the lack of constitutional status limits city power. But what if cities were embedded in a country's constitution? And that's where Italy comes in. And the next slide is just a bit of background. Italy has a three-tier administrative system. So there are municipalities at the lower level, then provinces at the second level, and then at the third level, regions. So in the map, the colored ones are the regions and the two-letter acronyms are provinces. So before the 90s, Italy was highly centralized with all formal powers residing within the state. But then a set of decentralizing reforms was set in motion, and that's the subject of my investigation. So in the next slide, you can see the timeline of these reforms. In the 90s, as lawmakers realized that urban areas were expanding, they introduced the idea of metro cities, which they saw as a level at which urban issues associated with high population density could be more efficiently addressed. And then in 2001, we had a constitutional referendum, which is how we changed our constitution, which effectively ended decentralization of the state. So it gave constitutional standing to each of the levels I talked about earlier, municipalities, provinces, regions, and metro cities. So making these autonomous entities with their own statutes, powers, and revenue autonomy. And this referendum also established that the principle of subsidiarity was going to govern the distribution of power between these layers. And for those of you who are not familiar with this, this is the principle that power should be attributed to the lowest level possible that is suitable to the job. So it is not, however, until 2014, what you see on the right with the Del Rio Act, that metro cities actually came into being, despite having been in the Constitution since 2001. Rather than introducing new boundaries for metro cities that match the growth of urban agglomeration, this act established that these 14 cities would replace the provinces in this area. So if you remember, these are the intermediary levels between municipalities and regions. So essentially, metro cities take the powers of the provinces that they replace, mainly maintenance of schools, roads, But on top of it, they gain new powers, which you can see in the next slide, mainly strategic planning, economic and social development. One interesting thing about this reform is that one of the official functions of Metro City is that of fostering relationships with other European cities, which I'll go back to later. And briefly on governance, the mayor of the biggest city in the metro area automatically becomes the mayor of the metro city. So the mayor of Rome is also the mayor of the metro city of Rome. So now this was a very brief overview, but what I'm interested in my research is to what extent have these changes helped to overcome the limitations to city power that Brifol, Schreger, and Herschel were worried about. And my findings suggest that not a lot. And on the next slide, you can see the positive upshot of these reforms in terms of power, which is that formally metro cities now have more immunity to preemption than previously. 4 regions actually did try to file an appeal against the new powers of metro cities, but the Constitutional Court dismissed the case. So there is some form of legal protection. Secondly, some of the powers that were conferred to metro cities above and beyond provinces could enable some of these metro cities to have more influence on the national arena. And I'm thinking specifically of the powers related to socioeconomic development, which for some cities like Milan that are quite competitive can be quite influential. And then finally, because of this clause about fostering European relations with other cities, metro cities have gained access to platforms such as the EU Committee of the Regions and others, through which they could bypass national constraints and influence national and international policymaking. And Professor Foster, who's on this panel, has written some great work on this. On the other hand, however, I did find that some serious limitations remain in terms of these reforms. And the first one is that while we don't see the type of preemption that we see in the US, regions in Italy still get in the way of metro cities. For instance, some regions held back some functions such as environment and agriculture and tourism, which they could have well delegated to cities according to the principle of subsidiarity. Secondly, there are several concerns with funding, because while the Rio Act created metro cities, it also took resources away from the intermediary levels of government in an attempt to cut costs. So this has been problematic. And finally, very importantly, the Rio Act, as I said before, assigned metro cities the boundaries of provinces, which were created in the mid-20th century. And this defeated the rationale for which metro cities were created, which is that the functional boundaries of cities had been expanding. And what I mean by functional boundaries are the areas that are economically and socially dependent on a city. So these had been expanding. And so what you end up is a situation like this in the next slide, which is that some cities like Milan and Rome, for instance, were assigned administrative boundaries that were significantly smaller compared to the functional areas, while others were given bigger ones. And I think that in both cases, this has potentially negative implications for city power. So in conclusion, I think this is a very bittersweet reform for Italian cities. And I think it speaks to the difficulty of empowering subnational governments, despite the fact that subnational governments have come to play a bigger role in our lives, especially in the COVID crisis. And so I would like to leave you just with some potential questions that I'm grappling with that I think apply beyond Italy and can help us think about the balance of power between national and subnational government. So the first of these is, if constitutional empowerment on its own cannot help cities overcome city powerlessness, what can? What are other tools that we might consider? The second question is about the principle of subsidiarity, which is kind of hailed by scholars as kind of the gold standard of devolving power, but I have some doubts about how this can be implemented in practice to avoid preemption from higher levels of government. Thirdly, from a more realist perspective, how can we get around practical limitations to city power involving funding and administrative boundaries? And then the third question is, if the domestic channels for greater subnational empowerment are just doomed, what are other promising ways through which cities could exert their influence, for instance, through transnational networks? So thank you so much. And I look forward to hearing your comments.
Thank you, Elena. That was great. Khushbu, do you have your audio back?
Hi, can you hear me now?
We can hear you. It's a little faint, though. Can you get closer to the microphone?
Okay. Yes, I'm going to try. I hope
Perfect.
this is
That's
better.
great. Yes, that's great. Thank you.
Apologies for the technical error. Hello, everyone. My name is Khushbu Shah, and I'm a junior at Georgetown University in Qatar. My research explores the politics of self and city making in Qatar and argues that the online politics of self-representation on Instagram is connected to Doha city making practices. The state of Qatar is located in the Middle East. It is situated in the Persian Gulf, and Doha is the capital city of Qatar. Towards your left, you will see an image of West Bay district in Doha. It is a business district, and over here, the skyscrapers are symbolic of the rapid economic growth Qatar has undergone in the past couple of decades, which is fueled by its oil and natural gas wealth. Towards the right is a picture taken from Qatar Cultural Village. It is also one of my case study sites, and it is a zoomed out image of Qatar's sea line and skyline as taken from sunset. If you look closely towards the right, you would see a harbor where a dough is parked and which is the traditional boat. And it's important to our research because it shows the different ways in which the city is perceived by its residents. So just before we move in, a couple of definitions. So over here, self refers to the individual, the city inhabitant, and it refers to how the person sort of interacts with the city and in the city and consumes spaces and architecture. And it is also building onto the research on self-making. So it's about the modulation between internal desires and external conditions. City making over here ties into the literature, which is in the larger conversation of city branding, which is the process of using a city's unique characteristics, such as its culture, physical resources, heritage, and art, to create a unique identity for it, one which distinguishes it from other cities. So since branding makes the city's image, and since my research is about perceptions, city making is a term used henceforth. Drawn on Wittgenfeld's work, the paper also argues that self-making is how individuals choose to represent themselves on Instagram at that particular place, at that particular time, and through that specific image. And this forms their mediated identity online. So next slide, please. Given this introduction, my research focus is, I can't see the slide, okay. How do Doha's denizens interact with Pearl Qatar, Lucille City, and Qatar Cultural Village to shape cityscapes? So these are the 3 case study sites that I have chosen, and the images that you see here are what they have been officially branded online. So Lucille City is a city that is still in construction, and it is branded as a futuristic city. Qatar Cultural Village, on the other hand, is a site for social and cultural activities, and the Pearl Qatar is a man-made island, and it is built in the shape of pearl, and in a way it harks back to Qatar's previous economy, which is based on the fishing and the pearling industry. And you will see 36 towers that are sort of created in the shape of a pearl. It seats multiple residential spaces, consumption spaces such as cafes and restaurants, and other workspaces such as fashion boutiques and other shops and spaces. Next slide, please. So the next slide talks a little about the major themes of this research. So one, as I've mentioned, it's about self-making and city making. The research findings tease out that this is the city making practices of Doha's denizens underline the politics of land and real estate, work, leisure, and luxury, city branding, and nation branding. So just to clarify, the reason I separate leisure from luxury in Doha's context is because leisure can be defined as a desire for pleasure, and it's activities one may pursue in their free time. However, leisure can also be spatial, and this is what these spaces, these built environments enable. On the other hand, luxury is associated with indulgence, a luxury product emits material and sensory pressure, which is a sophisticated version of the basic good. So these architectures of spectacle are not only emitting state power and prosperity, but also are emitting a certain kind of mindset which is branded to be luxury, which we notice from the way individuals represent themselves online. And going to the literature review, the reason this research is important for Doha is one, because images serve as substitutes of reality. Through images, individuals communicate how they were interacting with that space at that point in time. Secondly, literature shows that there are several brands of Gulf states, and this has to do with the construction and their nation branding strategies. And the other thing is that online self-representations are mediated identities. And together, in Doha's context, they contribute to city-making practices. Next slide, please. Just a short comment on methodology. So although this was done on Doha cityscapes, I conducted this research when I was in India during the pandemic last semester. And I used digital ethnography to make sure that the method adapts to the work that needed to be done. So I had 6 online field sites. The work was done over the 3 hashtags of the 3 places and geotags, which is a feature that Instagram has where you tag the place. And each day I would observe what is happening on these hashtags and geotags and sort of tease out the patterns of how Doha's denizens are representing themselves online. It is important to note that this is an elite percentage of the population. This is the percentage of Doha's residents who use Instagram. And it is also important to note that the data was collected systematically. I created a database of 5,136 images. And these images were selected based on consumption activities, whether the image has any symbol or interaction with the space or with food or with other people in that thing. And to avoid algorithm bias and to make sure my research is externally valid, I revived the old account to ensure that my current Instagram's algorithms do not influence this. Next slide, please. So now to move on to the primary research findings. So self and city making in Doha happens through consumption and through memory and nostalgia. And memory and nostalgia and consumption are related to each other. So consumption happens through food, real estate, physical products that have to do with such as clothes, shoes, other products that you would sell in, let's say, grocery stores, and experiential products. These have to do with water sport activities. These have to do with the service itself that a luxury restaurant provides, with yoga activities and how the built environment is used. And memory and nostalgia refers to how denizens convey perceptions about Qatar's past, about how they feel in the place as represented, like what is their notions of sense of belonging, and how do they express pride for Qatar, or how do they express whether they like to be in the city or not. And also it's important to know that this is one way to interpret the findings, given the fact that these are images and they are open to multiple interpretations. And I would like to open it up to discussion too on how there are multiple ways of this can be sort of analyzed, but this is one of the ways I interpreted based on the dominant patterns I observed over the month. Next slide, please. So going back to the point on the politics of land and real estate. So in the context of Qatar, real estate is branded as a luxurious experiential products. Denizens are often looking at construction sites, and they are sort of promoting these sites to be future places of luxury. The state's official agenda, which is to brand these places as luxury to attract foreign investment and to cater to an elite clientele, lives through people's interactions in the city. So for example, to the top right, you see a picture of one of Lucille's construction projects. However, the caption reads as terrific construction view. And although construction over here we see is being glamorized, we see that there is an emphasis on the skyscrapers that have been constructed in the background. The other thing it is important to note is that work and labor relations are made invisible through these perceptions. There is little emphasis on the people who are actually building these firms. There is little emphasis on the migrant laborers. There is little emphasis on who is constructing this, who are the people who are actually involved on the ground. And this is the politics of invisibility that is being played at, because there is a promotion of luxury and leisure with sort of sidelines work. Next slide, please. Another key thing to note is that how architecture is being consumed makes a comment on how Doha is perceived by its citizens. So over here, you would see that there is a gendered narrative. There are on Instagram, I noticed a trend that there were more women whose posts were being highlighted, who were consuming architectural spaces. And these spaces often communicated a message of being of either that they would prefer to be in Doha that is a constructed Doha. For example, over here, the picture to the left, I'll just imagine I'm in Italy. So this is a reference to Venetian architectures, which the Pearl is sort of created to emulate. And this is the kind of conversation that you see happening throughout. So you would one can argue that they see Doha not what as it is, but what as it could be, or something that is imagined, or kind of a construction of memory is at play over here. Next slide, please. And finally, I argue that self-city and societal relations develop in relation to one another. So to the right, you see the top post of an Instagram feed. This sort of reinforces how this not only a gender narrative, but the built environment is being portrayed in a certain way by majority of the people, by majority of the denizens. And there is a perception of luxury leisure, of glamorizing these architectures. On the other hand, an individual posts of work of migrant labor are sort of, you can see them in different parts of these field sites. For example, as individual standalone posts in the hashtags and geotags. So these are examples of people who work in Qatar, and you will see these are less glamorized posts. They are in uniform, and it's emphasized that these sites are also serve as workspaces for the people who are engaged in work-related activities out there. But as denizens engage with these spaces, these work relations are sort of either sidelined or not engaged with. And this is how I come to the conclusion that self-city societal relations are working in play with work, leisure, and luxury relations. Next slide, please. And finally, the relevance of this research. So I must say that this is an ongoing research. There are a couple of themes that need to be flushed out more. So one is class and labor relations. The second is collecting qualitative data to sort of understand how do people who work in these spaces and in these spaces of high luxury, what do they perceive of these work relations and luxury relations? Second of all, it is important to understand how do these consumption spaces communicate to one's sense of belonging. And also read into the literature on the urban citizenship and what does this mean in Qatar's context, which is also run by a monarchy. The regional relevance is to compare it with other Gulf brands. For example, for Dubai, in literature, they say Dubai has a different brand as compared to Doha. And Doha, with its national vision, is trying to have a brand that is trying to balance traditional values with modernity. So what does that mean for its denizens? In a bottom-up perspective, what does this mean? And the international relevance is this feeds into the conversations of globalization and changing cityscapes, and how does this tie to other things that Qatar is engaged with, which is the most upcoming, which is the 2022 FIFA World Cup, and all the changes taking place in the city because of these city making practices. So my further research is going to look at the nexus of this top-down city making practice and the bottom-up approach, which sort of has started off with the Instagram research, and seeing what is happening at the nexus of both practices. Thank you very much.
Thank you, Khushbu. That was fantastic. We are running a little bit behind here. We do need to end at 3, but I want to open this up to Angela, and we've been joined also by Professor Sheila Foster. This is the most open-ended and kind of panel that really engaged issues of broader globalization. Please, Angela, hand it over to you.
Thank you. Thank you all for your presentations. Really interesting. And the issue of power came up a lot in different ways this time. I was so glad, Jack, that I don't know if you actually said power in your presentation, but I was thinking power the whole time that you were presenting, because that really is what is missing. this notion of resilience, or the absence of it, is very much tied to the power of people who often are most vulnerable within a geographic area. And I really like the challenge that you put out to the resilience community, because it has had so much traction recently. And while I think there is a there, it hasn't been placed enough within the context of the dynamics to be meaningful. So I just love the direction that you were going and want to hear more about it. And then Elena, you actually talked about power. And so it came at such a nice point where I was full of thinking power, but not spoken, but it was clearly in Jack's mind. And then you pulled it out. Of course, we're obsessed with this in the United States because we have so much progressive activity in cities that is getting thwarted at the state level or at the federal level. And cities are taking on so much responsibility where the real money to deal with it is often at the county level. And cities and counties that are one, like Los Angeles and San Francisco in California, while they certainly have plenty of problems, and Los Angeles is overrun with homelessness, there's so much more capacity and awareness and an integrated notion about these things that I was really fascinated by the way that you were lifting up in a context of which been to Italy, but unfamiliar, really never even thought about it in those ways. So that was really challenging and helpful. And Khushbu, I was really challenged by your presentation because I couldn't quite figure out what to do with it. And so what I want to know more about is what are the implications of all this really interesting, insightful, thoughtful work that you're doing, pulling together things that people often don't even think of as going together, but yet they're impacting each other. So I'm really learning, listening to you, and want to think about what are the implications of it for how we misunderstand places that we only are viewing on the internet, and how jurisdictions are missing the opportunity to be more engaged with the self work that people are doing in terms of how they want to be seen, and whether or not they're stepping back and getting guidance about how our built environments are actually being utilized in broader than who's going there, but how are people withdrawing things from it in terms of leisure and luxury and work and self-image. Interesting stuff. I really appreciated it.
Thanks for joining us, Sheila.
Sure, no, these were great presentations. And I want to, just for lack of time, try to tie together what I see as the theme of them, right? And it strikes me, so these were all different cities in different parts of the world, right? Situated within different political, economic, social, and cultural contexts. But the one thing that you guys all hit on is the kind of tension between bottom up and top down, right? When we think about cities and city power, right? And also the place of people who live in cities and their relationship to the city itself, right? And to the sense of belonging. So that just struck me really powerfully. So starting with Jack, right? I mean, so really interesting to look at African cities. So African cities have a particular problem, and that is that mayors have no power. Local government has no power, and the national government holds a lot of the power and resources, and partly, and then international institutions are, of course, have a huge influence on how national governments respond and what they do. So what was fascinating to me about your presentation was you're really focused on kind of how neither of those levels of government, and maybe not even the local, has this equity lens, right? And where and how can we inject that equity lens? You mentioned transnational networks and agencies, right? Need to infuse themselves with that. And so so transnational networks are kind of bottom up, because these are local governments coming together often to share information and try to push higher levels of government, right? They're often jumping over, as Elena said, their national government. So mayors of African cities are working with the transnational city networks to try to push on international institutions to bring them the kind of relief and resources that they're not getting from national governments, right? So, but one question I had is, well, but what power do transnational networks really have? What resources? That doesn't really get to the resource issue that I think you rightly point to. They can bring the equity lens, but at the end of the day, to make their communities resilient and sustainable, these cities need resources, and they're often resources they're not getting from national government. So on the one hand, bottom up, yes, local networks can, push on equity. On the other hand, you still do need resources from somewhere. So I was left kind of puzzled by that kind of mismatch between what these places need and where they're looking to get those resources. I mean, and Elena made the point that we may want, in theory, metro areas and cities to have power, but that's often easier said than done. And I know this paper a little bit more in depth because she wrote it as part of my class. The part that you didn't get to or didn't have time to get also suggests that even when you give local government or metro regions that power, sometimes we're not sure the way they're going to use it is the way they think they're going to use it, right? And that subsidiarity is a great principle. And I think the boundary mismatch that you showed in your slides is part of that, right? So again, the bottom up, top down, we have these challenges in cities, right? And we want cities are required and asked to do more about them, but they don't have the resources. On the one hand, the challenges are very localized, right, with the global overlay, because more of these cities have the same challenges than not. On the other hand, the resources, as Angela said, do not exist at the local level. And none of these reforms, legal reforms, do not transfer fiscal resources. So there's a mismatch between power, city power, and resources, which are all flowing top down, almost always flowing top down, right? So I thought that was interesting, that mismatch between power and resources. And then I do think that Khushbu, your project is, like Angela said, so fascinating. I was like struggling to wrap my mind around all the aspects. It was so rich, but it did make me think about kind of your idea of city making, made me think about the right to the city, right? And that is who gets to belong, right? And who gets to participate in the creation of what that city is. And I think what you show really powerfully is the way in which, cities are have become, in particular, the superstar cities like Doha, have become kind of a luxury item, right? They're not just sites of luxury, but accessing San Francisco, Los Angeles, New York, Doha, Milan, that not everyone can access them in the same way. Not everyone can engage in city making, right? So this idea of the right to the city, Lefebvre's idea of the right to participate in the creation of the city. I think your project shows really powerfully how that right, you say belonging, and that's one framing, but how that there is no right to the city for everyone. Right. And I think that your project does open up that. So anyway, fabulous papers, really interesting, really fascinating, and really global, as Uwe said. But it also shows you why the city conversation, the role of cities, around equity and a lot of other issues is so pertinent and so powerful, because even this diversity of cities faces quite similar challenges.
That's great. Thank you so much. We're coming to the home stretch here. Thank you for everyone's patience. We do have 2 more panels, but they've been intentionally designed to be shorter and quicker. And without further ado, I'd like to turn it over to Nick.
Great, thank you. And I'm gonna turn my video off just in case I have any issues here. So I'm in my last year in the Master's in Public Policy program at the McCourt School, and the research I'll be presenting is for my master's thesis. You can go to the next slide. Yeah, my thesis research is situated in this sort of intense ongoing debate over the relationship between new development and rent prices that's particularly relevant here in the district, which is where my research is focused. And the main takeaway from my research, I think, is probably pretty familiar to housing researchers and anyone engaged with housing issues. And that is that housing policies tend to be seen as they need to be seen as complementary tools that address different underlying issues, but that all intersect in particular ways. So just a little background, until recently, there hadn't been very much research done specifically looking at neighborhood level changes in development and rent because of both a lack of data at smaller scales and because of challenges with establishing that sort of causal interpretation between new housing development and rental prices. And in general, this recent research has shown that new market rate development modestly reduces nearby rents, though there is some variability in the effects seen for lower rent buildings, and also suggests that local context is really important. So much of this newer research relies on proprietary data that I didn't have access to, so I wasn't able to look at building level and rent data or isolate specific distances from new buildings. So I'm not able to draw as firm causal conclusions from my research, but using data mainly from the 5-year estimates of the American Community Survey, I'm able to explore similar topics and relationships at a census tract level. So you can go to the next slide. Between 2010 and 2019, which is where my study is focused, DC experienced a net increase in population of over 100,000 people, and non-Hispanic white residents made up over half of this increase in population. And these changes in population are important to consider in relation to the changes in rental housing units, because over the same time period, there's approximately a 22,000 increase in housing units. So a pretty large difference between population increase and increase in housing units. So if you want to go to the next slide. So now looking more at the increases in rental units, you can see that the changes in rental units are highly concentrated in particular census tracts in this period of 2010 to 2019. And the concentration is actually even more severe than is conveyed by this map. So just 3 census tracts accounted for over 1/3 of the total increase in rental units, with these census tracts adding over 7,000 units. So you can see the new development has been sort of highly concentrated. And we go to the next slide. And so now looking at sort of changes in median rent, you can see that these changes in median rent varies widely across the city, with many tracts increasing in median rent by less than $300, whereas other ones increased by over $900. And most of these larger increases in median rent have been concentrated in the central parts of the city. So there's a pretty wide range of changes in median rent that we saw in the district in these times. So you can go to the next slide. So for my study, I estimate 3 linear regression models. One is looking at median rent in 2019 in particular, and then another is average low-income rent, and as well as the percent of low-income renters that are housing cost burdened. And so the independent variable of interest for each of these is the change in rental units between 2010 and 2019. In all of my models, I control for housing and demographic characteristics as well. If you want to go to the next slide. So looking at the results in the specifications without most of the controls, I do find that increases in rental units are associated with higher median rents and higher average low-income rents. But in the full specification with other controls, the effect for both of these models is smaller in magnitude and not statistically significant. So I think, though, regardless of the ability to sort of disentangle the causal direction of the relationship between new development and rents, this shows that people might be experiencing rising rents at the same time as new development is going up, regardless of sort of the actual causal relationship at hand. And so this is consistent, I think, with one of the more recent studies, which suggested that new development may be a lagging indicator of gentrification, that demographic changes and rising rents may precede new development. And so 2 other important findings from my research are that rent control units and subsidized affordable units are associated both with lower median rent and with lower average rent for low-income renters. And so what I think this really suggests is that we have to sort of use the full set of housing policies at our disposal to combat the challenges and the range of housing issues that we face. And in the last slide, that's where I want to sort of end with. So in this slide, you really see what I think are 2 of the most serious issues that I think housing policy needs to play a major role in addressing. And the first is that low-income renters are sort of universally cost burdened in DC in particular. In a majority of census tracts in DC, over 80% of low-income renters are housing cost burdened. And the second is the really stark racial segregation that exists in DC that I think is pretty familiar to anybody who's been around the district for a while. So we need much more aggressive investment, both in building and preserving housing that is affordable to the lowest income renters. And we need to reform land use. So this housing doesn't sort of perpetuate racial segregation. These policies are interlinked, they're interconnected, but I think there are different tools that we need to be looking at to sort of address both of these. And so finally, we have to think about the way that political power also intersects with policy. We need to consider who has that power and the historical context of that power. We need to think more intentionally about how to empower Black and low-income renters that are sort of more at risk of displacement and give more agency to disinvested communities, while at the same time sort of removing exclusionary policies that have sort of gotten us to this point. Thank you.
Thank you so much, Nick. Fantastic. And I'll turn it over to Andrew.
Hey folks, my name is Andrew Grinberg, master's student at the School of Urban and Regional Planning, UBA. Let's get my slides up. So my project is titled The Six Spokes, Making DC a World-Class Bike Region. Next slide. So this was a collaborative research project that was conducted as a course last summer. One of the studio courses, we worked with an external partner, the Capital Trails Coalition. And it was a group project with 7 students. I would encourage folks who are interested to click on our story map because this was all compiled into a very publicly accessible, interactive site that is much more fun and interesting than this short presentation will be. Next slide. So the biggest key principles and findings of this project were really about the rapid transformation that our region needs to scale up bike ridership and bike infrastructure. We view bike infrastructure and other types of active transportation infrastructure as really key for the recovery from COVID-19 and dealing with the climate crisis, racial justice, air quality, health, economic issues, and improving the region's happiness and productivity. Next slide. So we landed on 6 key components, which we dubbed the 6 spokes, which I'll quickly go over. Building out on-street bike lanes, connecting the region with trails, designing trails and other bike infrastructure to actually attract people, marrying our land use and transportation infrastructure through trail-oriented development, developing and fostering unique and inclusive bike cultures in the region, and finally enacting policies that complement our bike infrastructure, even if they're not specifically about biking, such as congestion pricing and parking reform. Next slide. So the bulk of the quantitative research that I did was focused on our trail network here in the region. And so the Capital Trails Coalition kind of manages this trail network. And you can see in green our existing trail network, which is really quite extensive. The coalition is also identified, and that's about 480 miles worth of trails already that are built in the region. The Capital Trails Coalition identified another 40 trail projects, which they're pushing as kind of their top priority projects, which would add another 120 miles to the network. And then finally in orange, you'll see kind of the full built out final tier for the network, which would bring the total up to 870 miles. So a really extensive and well thought out and fleshed out vision for what a trail network could be in the region. Next slide. So really, as I was thinking about what does this trail network get us as it currently stands and what can it get us in the future and why is it so important, wanted to look at really who has access to it and what does it connect. And so the bulk of the geographic analysis work that I did was building out half-mile walk sheds for all of the classifications of trails and then figuring out kind of who lives within them and what is within those boundaries. And so the polygons that surround the trails are based on the actual street network in the region. And so these are all places that are within a half-mile walk of a trail. And so if you're in a green area, you can walk and actually get to a trail by walking about 10 minutes. So we found that over 1 million people already live within a half-mile walk of a trail. That's a quarter of the region, which is really significant But if we build this out, we can add another 500,000 people to being within that sweet spot of being able to walk to a trail. Similarly, lots of businesses, lots of jobs within the trail network already, and we can grow those numbers significantly. Next slide. The next question was really who, and who lives within that half-mile walk, and is it equitable? Interestingly, the existing trail network is fairly representative of the region from both a median household income and a race and ethnicity perspective. But if we really want to promote equity, providing very cheap and free transportation options through active transportation infrastructure, building out those priority trail networks will bring access to a much lower income subset of the population and a significantly less white and higher African-American portion of the region's population, which goes well with the last slide from the previous presentation, as many of those priority projects are on the eastern side of DC and in Prince George's County. Next slide. And then the other kind of set of analyses we did that I wanted to just give one snapshot of is what are the key things that our trail network actually connects to, and what can it connect to? So we ran a series of analyses on regional points of interest, the first being activity centers as identified by the Metropolitan Washington Council of Governments, transit access focus areas, which are transit station, high capacity transit stations in need of additional connectivity for multimodal transportation, and finally metro stations, which is what this map shows. And so amazingly, 51 of our 91 metro stations are already within a half-mile walk of an existing trail, but building that out, the trail network out, can add another 8 metro stations to this network. And that would leave still 32 metro stations which do not have trail access, and kind of points to some gaps and where we should be thinking about adding connectivity to improve and increase multimodal travel. Next slide. Finally, we did this project really as a call to action for local jurisdictions. And while we are on the path towards improving our transportation system, we really believe that the scale of thinking that we need in this region needs to be advanced significantly. And so just as one example, the left is the existing protected bike lane network in the region as it stood when we did this analysis. It has grown some since then. On the right is kind of a sample network of what I envision to be a feasible yet as aggressive as what's needed right now, which would put in a protected bike lane on every street of at least 40 feet in width or greater, which would still leave ample room for cars. And so this is kind of the thinking we envision is needed if we want to scale up bike ridership, bring accessible transportation, and reduce car dependency to the region in line with what's called for at this moment. And with that, I will go to the next slide, which I believe is the final one. Thank you to all the contributors. I'll leave it there.
Thank you so much. That's great. So we don't have a student respondent on this panel, so we'll go straight to Angela, and we're joined by Katie Wells as well.
Well, I was really fascinated by the notion that building new housing is a lagging indicator in a community. Did I get that right? That was Nick. Nick?
Yep, yeah, that was sort of what one of the other previous research had shown a little bit, and what I thought that might be indicated with this, yeah.
So that was really interesting to me because I have seen so many community efforts to try to stop new development because they are absolutely certain that this is going to lead to displacement and higher rents and all of that. So that was interesting. I've seen the debate go both ways, but I hadn't seen data on it the way that you just presented it. So I was really fascinated by that. I was left really wanting to know more about what kind of new development actually would bring down rents and how do you do that? Because that seemed to me the thing that people often want is more affordable housing. And so if you're going to build a new development, at what level does it tip toward having so much affordable housing that it starts to make a difference? So fascinating, thank you. And I would like to know more. Regarding the bikes, that is always a point of great interest because I've done a lot of work around health and obesity and how important it is in low-income communities and low-income communities of color to be able to invest in the kinds of things that actually both are good for the environment, but help people to be more active and reduce the cost of transportation and deal with the fact that there's not adequate transit. And so it's fascinating to think of what it would really take. And while certainly access to bike trails is important, there are also other things in terms of in low-income communities and low-income communities of color. What are the other things that people have to do in terms of transit? What are transportation? How to make sure we're thinking about childcare needs and school needs and work needs and the lack of grocery stores in communities and where people are going to get their food. So I think that the access to bike trails and the access to bikes and all of the things in terms of the usual things that happen in a community when people are trying to increase bike use often miss the lifestyle challenges that are so crucial to deal with. So I'd like to know more about that, because if we really want to increase low-income Black and Latinx people utilizing bikes, we have to go beyond access. Did I miss one? No.
No, that was great. That was great. Please forgive me, Izzy. Please forgive me. I skipped over you. Introduce yourself and please offer some reflections.
That is okay. I was a little bit worried for a second. I don't know that my responses will be as profound, so I think it would have been okay, but I'm glad I get to put in my 2 cents. So just to give some context for my responses, I'm a student in the Urban and Regional Planning program. I do have a public policy background from Nevada. I currently work at the Massive Data Institute at McCourt. And Nick, I'm also interested in this little niche intersection between research, data, policy, urban planning, and housing. So I was really excited to see your project. I had a few observations and then perhaps, for future analysis or research. So the first thing I wanted to say was that as someone who works with the flaws and challenges of census data all the time, I appreciate that you use census tracts instead of blocks or block groups, especially for that ACS data. I think that makes it much stronger. One thing that I found really curious, and I do see this over and over again, not just in your data, but in sort of the common literature, is this really strong narrative around gentrification that's obviously loaded with a lot of historic context. But then I tend to see a different story in the data. And I think you tend to see this sort of exchange between the terms of displacement and gentrification. And so I think what would be really helpful is clarification around how you're defining those 2 terms and really pulling the thread on that conversation, even though it might be a little bit challenging. And then you make a finding about rent-controlled units, which was kind of interesting because that might imply that you have data on where rent-controlled units in DC are. I know that's been a big thing for the district. They haven't completed their database on that yet. So I was curious about what data you used for that. And then next for Andrew, that was amazing. I'm really fascinated by trail-oriented development as a term, and I really think that that should be incorporated into conditions assessments, TOD, and DOT efforts. I only have a few suggestions really, and they may just be questions since I know this is only a fraction of your actual project. I was curious about the term fostering unique bike cultures. And then did you do a racial impact analysis on the non-priority trails as well to see if there's a discrepancy in priority? And then I was curious if there are private trails that aren't captured here or if this captures all of the trails. And then again, linking trails to transportation like this, I think is so important. I grew up in Nevada and I may be biased, but near some of the best trails in the country. And I can't emphasize how much I think that this would fundamentally change the nature of commuting and moving around in cities. So great project.
Great. Katie?
Sure. Thank you guys, Nick and Andrew. This was super fun to listen to. Nick, I am going to send you a link in the chat. There was an op-ed this week in the New York Times that to me really resonated with what you were talking about. What stuck out for me in your talk was your point that 3 of the census tracts in DC had 1/3 of all of, I think you said, the new housing development. And so that really sort of stuck out with me as a point that I think I'll carry forward. But that point sort of goes with what the New York Times was asking this week, which is what happens when we have 10 million tenants in the US that can't make rent? in the coming months. And it was a call for a social housing development authority, right? It was sort of asking the larger question that you're gesturing toward. And so I love having this sort of piece as part of a larger conversation. So thank you for that. Andrew, so fun. This is great. What I would be curious to hear more about is about how the Capital Bike Share does or does not fit into the story that you're telling. And I'd also be interested in a backstory, a little bit about the history of development. It's awesome that right now the way in which the trails are presented feel or appear, just with regard to class or race. I'd be curious to know sort of 10, 15 years ago, what was the story and what was the impetus for changing that if it was a significant change. Thank you, guys.
Great. We are going to finish at 3 o'clock. I'd like to thank everyone for your patience. We have set this up so that this last panel is really more about thought leadership, and this is formative research that's emerging. I'd like Kevin and Ali, if you could both spend about 3 to 4 minutes provoking us with some of your work. Kevin, over to you.
Thank you very much, Professor. Everyone, I'm Kevin Schlosser, a part-time grad student at McDonough School of Business. I'd like to thank Enrique and Professor Brandis for organizing this today, and for Angela and Katie for your time and input. Next slide, please. So Washington, D.C. has become a technical and political development hub for autonomous vehicles. The region's highly skilled workforce and rich and complex mobility ecosystem has attracted industry stalwarts to come and test and operate AVs here, such as Ford and their partnership with Argo, and startups like Perrone Robotics. And it really is the rich mobility ecosystem here is what attracts these companies to the region. Because if automated vehicles in ride-hail, delivery, or a shuttle type service can succeed here, it's likely that they can succeed anywhere. So next slide, please. So various attitudes, travel patterns, infrastructure have contributed to DC's overall mobility ecosystem. Poor traffic, high insurance premiums, fairly good public transit system, but we're also very fortunate to have some very strong stakeholders, both in the form of government agencies such as DDOT, DEMOA, and then also some independent grassroots organizations on transportation advocacy, such as DC Families for Safe Streets and Washington Area Bicyclist Association. Next slide, please. So any AV service launched here and anywhere should have a people first, community first type of perspective, both to quell any of the public's apprehension around autonomous vehicles, and then also to ensure long-term success of the deployments. Many nationwide studies have been conducted on public perception of AVs. Very renowned one from AAA, and overall they do not paint a very rosy picture of public perception of autonomous vehicles. But the potential benefits of AVs are undeniable. Safer, more efficient, more accessible, more equitable transit, just to name a few. So this is why I suggest doing 2 sets of surveys, and I hope to have these completed this spring. One would be a traditional survey, randomized, significant sample survey aimed at DC area residents on their thoughts on autonomous vehicles. And then another one targeted specifically at the transportation stakeholders in the region. Groups like WABA, DC Families for Safe Streets, these folks live and breathe transportation policy, and perhaps know DC transportation issues better than anyone in the region. So ultimately, I think this research opportunity to listen and really understand how these technologies can serve our region build relationships and collaborate on shared goals between industry and government, tailor communication and policies around these vehicles, and then ultimately build products and services that can meet the region's needs. Thank you for your time and look forward to any of your questions.
Thank you, Kevin. And Ali, you're going to close us out here.
Sounds good. Hi, everyone. Thank you so much for coordinating this event. I'm Ali Fordyce, a second-year master's student in the Communication, Culture, and Technology program here at Georgetown, and I'm currently writing my thesis on ensuring equality in the future of smart cities. What are the key ethical issues in algorithmic decision-making of facial recognition technology, and how can they be managed? All right, next. So where and how is facial recognition technology being used? This map is a US example created by the Fight for the Future organization, a nonprofit digital rights advocacy group showing the prolific use and evolving legal restrictions of the US facial recognition use of facial recognition technology. Its use has spread to many urban and public areas, such as stores, airports, stadiums, law enforcement, public schools, and other public venues. As consumers, we use facial recognition every day, and it isn't always harmful, like to unlock our phones, sort through photos, etc. But the ways governments and companies use facial recognition can have a much more problematic impact on our lives. It is mostly used as a tool of surveillance, and the way that data is used can be counter to basic privacy rights and is subject to exploitation. Mass protests last summer caused a reckoning for how large corporations like Amazon, IBM, and Microsoft are using facial recognition technology data. Some companies temporarily prohibited software sales to law enforcement, but with the ubiquity of surveillance technology, it's difficult to escape. Next slide. So key issues with algorithmic decision-making. While the technology has many beneficial uses, it has been widely criticized for privacy violations and built-in bias issues, which creates a need for effective policy restricting the maluses of the technology. The primary concern with biases in algorithmic decision-making is rooted in dataset bias in algorithmic design. The accuracy of the way the technology works depends on having a broadly representative data sample that trains the algorithm. Without that, certain underrepresented groups are subject to higher error rates in the detection and analysis process of facial recognition. This graph displayed demonstrates the discrepancies in recognition accuracy towards certain groups. Most subject to accuracy errors are women of color. Next slide. How can these ethical issues be managed? So three main categories where these ethical issues can be addressed and mitigated are legal, technological, and in ethics. And this is something I'm still very much in the process of researching for my thesis. Legal safeguards involve laws that place restrictions on the use of facial recognition technology, like Congress's Ethical Use of Artificial Intelligence Act. Setting guidelines for legal use of the technology places like San Francisco, Boston, Portland, and Oakland have outlawed city use of their surveillance technology. And notably, the National Security Commission on Artificial Intelligence very recently finalized a report in part setting guidelines for achieving justified confidence in and upholding democratic values in AI deployment, demonstrating a strong nationwide legal framework and commitment to regulate ethical AI principles. Technological safeguards involve procedures embedded within the algorithmic decision-making systems. This involves checks and balances built within the system itself to offer transparency and mitigate bias. Another form of technological safeguarding can involve open sourcing data in order to create transparency with the public. And then lastly, ethical safeguards are typically a set of guidelines like the abbreviated list shown set forth by the European Commission. They are not as binding as laws, but offer companies and organizations a set of standards to meet in order to be deemed as ethical systems. In general, there's a long way to go to achieve ethical implementation of AI, but awareness and bias mitigation is moving in the right direction. Yeah, so that's it. Thank you.
Thank you so much, Ali. I'd like to thank both of you. The intention behind this last panel was really to kind of stir things up a little bit and point to very challenging questions that we have before us. Katie, I'd like to invite you to just share a reaction, maybe 1 or 2 minutes. Your work is in this space as well. And then I've just got a couple of closing remarks after that.
Well, I'll just say bravo. I mean, Ali and Kevin, this is so fun to hear about your guys' work on AV and AI. It's something I think about a lot with my work on workers in the gig economy as I navigate the promise of AV and the perils of face recognition technology. An author that I was reading this week that I thought maybe you'd want to play around with as you guys sort of, continue with this work, which I hope you will. And Kevin, it sounds like you're about to undertake, is someone named Ruha Benjamin. You may want to sort of check out her work. It's okay, so maybe you already know it. Fine. All right. So your work really spoke, and it sort of is obviously something that's going to push my thought getting to hear you guys today. So thank you.
That's great. And I see Margaret O'Brien has been with us this whole time. Margaret, I do want to extend the opportunity to you to just say a few words. Any reactions?
Yeah, I thank everybody, and I just think what keeps driving home is the global nature of so many of these issues, particularly ones around equity, inclusion, and issues around bottom up, top down in terms of power. So I learned a lot. Thank you so much. Yeah.
Angela had to drop off, but that's okay because we have access to her a number of times over the balance of the semester. I just wanted to close by saying a couple of things. One is a huge thank you to each of you for stepping up and participating. This is, from my perspective, an extremely non-traditional forum for students to come together. I am often frustrated by the self-imposed silos that we have created at the university. And I think one of the great strengths of the, or one of the great promises of the Cities Initiative is to really conduct conversations like this that bring very different people together. So a big thank you. I do want to also point to our website. We have a number of events, including some that are not posted yet, that have been designed around Angela. I think you'll find, and I think you found today, her background and insights are extraordinary. And so there'll be more opportunity to engage with her. And I invite you to participate in those. And then finally, we are in the process of building more capacity and fleshing out what we hope will be a kind of a durable and also very provocative student scholars network. And so I already have a couple of ideas on things that I would like to do with each of you following this event. And I always share this with all the faculty that I engage in the context of the initiative, and that this entire endeavor is a coalition of the willing. There is absolutely no need to participate in anything that we do. If you don't want to, that's great. But if you do want to, the door is wide open. We really are very, very interested in cross-pollinating the work that you're doing, and by doing so, strengthen the networks and the peer-to-peer learning that can occur through interaction. And so, big thank you. We'll be following up with you with more emails, and I'm already thinking that there could be some really fun, more casual kind of interaction that we can foster even over the course of the next weeks and months. So let's declare success. Thanks. And thank you to everyone. And I just think it's just, of course, this is such an odd time that we're living through, but isn't it amazing that we've had people from Qatar and Brazil on this call with us, including all of our colleagues here in DC. So big thank you for making the effort, and we'll be in touch.
Thank you.
Thank you.
Take care.
Thank you.